Welcome, Minister.
Good morning.
Welcome, Mr. Tidball. You're in your permanent seat there. He doesn't even have to vacate it overnight. He can just stay there.
The multi-talented Mr. Tidball.
Welcome, one and all. We'll get started. Welcome to the second hearing of Portfolio Committee Number 5, Justice and Communities, for the inquiry into Budget Estimates 2025-2026. I acknowledge the Gadigal people of the Eora Nation, the traditional custodians of the lands on which we are meeting today. I pay my respects to elders past and present and celebrate the diversity of Aboriginal peoples and their ongoing cultures and connections to the lands and waters of New South Wales. I also acknowledge and pay my respects to any Aboriginal and Torres Strait Islander people joining us today. My name is Robert Borsak and I am the Chair of the committee. I welcome Minister Harrison and accompanying officials to this hearing. Today the committee will examine the proposed expenditure for portfolio of women, seniors and the prevention of domestic violence and sexual assault. I ask everyone in the room to please turn their mobile phones to silent. Parliamentary privilege applies to witnesses in relation to evidence they give today. However, it does not apply to what witnesses say outside of the hearing. I urge witnesses to be careful about making comments to the media or to others after completing their evidence. In addition, the Legislative Council has adopted rules to provide procedural fairness for inquiry participants. I encourage committee members and witnesses to be mindful of these procedures. Welcome and thank you all for coming and making time to give us evidence today. All witnesses will be sworn prior to giving evidence. Minister, I remind you that you do not need to be sworn, as you have already sworn an oath to your office as a Member of Parliament. I will also remind Mr. Tidball, Ms. Campbell, Mr. Smith and Ms. Jarrett that you have already been sworn before the committee during this inquiry and therefore do not need to be sworn again. For all other witnesses, could you please state your name and position title and swear either an oath or affirmation? Please begin with the first witness on my left. That's Ms. Smythe.
Correct. Tanya Smythe, Director of Women New South Wales in the New South Wales Cabinet Office. I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth.
Thank you. Ms. Walker.
Good morning, my name's Simone Walker. I'm the Acting Deputy Secretary for Social Policy and Intergovernment Relations at the Cabinet Office. I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth.
Thank you. Ms. Tonkin.
Hannah Tonkin, Women's Safety Commissioner. I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth.
Thank you. I might get Ms. Quincy to come up, please, and just take the oath now.
Jennifer Quincy, Executive Director of Women, Family and Community Safety in Department of Communities and Justice. I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth.
Thank you. Today's hearing will be conducted from 9:15 a.m. till 5:30 p.m. We are joined by the Minister for the morning session from 9:15 to 1 p.m. With a 15-minute break at 11 a.m. In the afternoon, we will hear from departmental witnesses from 2 p.m. till 5:30 p.m. with a 15-minute break at 3:30. During these sessions, there will be questions from opposition and crossbench members only, and then 15 minutes allocated for government questions at 10:45 a.m, 12:45 p.m. and 5:15 p.m. We'll begin with questions from the crossbench. We might start with Ms. Boyd.
Thank you very much, Chair, and good morning, Minister, and to all of you. I asked the Premier yesterday about why the government is still not funding an increase to those frontline services that sort of make the difference between life and death for a lot of women fleeing domestic and family violence. As you know, there has been a significant call from the sector for years and years. We know that waiting lists for these services are on average 2 months and in many areas many times longer than that. Why didn't this government fund in this budget that core increase that the sector was looking for?
Thank you, Ms. Boyd, for the question. Firstly, I'd like to acknowledge also that we're on Gadigal land.
And to your question, as the Premier said yesterday, we have certainly been hearing from the sector and in particular Domestic Violence New South Wales about the challenges that they're experiencing in relation to workload. It's certainly something that we heard during the workforce survey that we undertook as part of the workforce development strategy. We are in the process of, and one of the key things that we did last year was to increase services across New South Wales where there were significant gaps. That was a real priority for us to make sure that there were services where there were gaps, particularly in relation to staying home, leaving violence. We are continuing to listen to the sector in relation to the challenges they experience in relation to workload. And I will continue to work towards helping them with that workload, whether that be through additional resources, whether that be through our workforce development strategy, whether that be through other ways of improving services across New South Wales.
I appreciate that you may personally be listening to the sector, but when the sector is telling this government that the number one thing that the government can do to improve women and children's safety and to stop them from being murdered in their homes is to ensure that they have somewhere to go to that can support them when they need it, and that requires a 50% uplift minimum in their baseline core funding, which has not been increased for years and years, and this government continues just not to do it. Do you think that your government is listening to the sector?
We certainly are listening, and that's one of the reasons. But certainly one of the things that the sector also said that they wanted was certainty of funding, and that's why we have brought in 5-year contracts for domestic and family violence. Just to interrupt you there, Minister, sorry. I know the temptation is to, in response to answers about why the government isn't doing something, is to then tell us what the government is doing. I appreciate, I'm not saying at any point that the government has done absolutely nothing on domestic and family violence. I'm talking about the core issue, which is an increase that's only 163.1 million. I say only because we're looking at recurrent expenditure in this budget across everything. So not infrastructure, but just that recurrent expenditure of $127 billion. And yet we can't afford, the wealthiest state and one of the wealthiest countries in the world, to give $163 million to frontline services so that they can stop turning women and children away when they're fleeing violent perpetrators. What does that say about this government's priorities? Well, certainly changing the dial on the numbers that we're experiencing, changing the numbers of women and children who are murdered is an absolute focus of this government, and that is why we have been listening to the sector. The things that we have been doing are as a result of calls from the domestic and family violence sector. Domestic Violence New South Wales has been calling for an expansion of staying home, leaving violence. They've been calling for an expansion of specialist children workers across New South Wales. They've been calling for increased accommodation across New South Wales.
We'll come to those things because I think we can quibble on exactly how much has been provided for those as well. But let's just come back to this core function. We have services that, and we know, and you know, that that most dangerous moment for a woman is when she is leaving a domestic violence relationship. That is the most dangerous moment, when she is at most risk of domestic homicide and of violence and abuse and all sorts of horrible things being done to her and the ones that she loves. That is that moment. And when she goes to her local service, and those poor people who are working at that service have had to let people go because they've not had an increase in core funding. They've had to, close their doors. They don't have the resources to support that woman. Those centres will do everything they possibly can to direct that woman to safety, but women are falling through the gaps because of these really long wait lists, 2 months on average. All it would require to bring that sector back up to capacity was $163 million, and your government was incapable of providing that. I understand that you may be listening, but aren't you frustrated with your government as a whole for not providing this very basic core funding to the sector?
Look, I think the work that the government has been doing in relation to domestic and family violence is actually really important work. We haven't provided everything that has been asked for, but we are working towards changing the dial. And the work that we have been doing is directly as a result of calls from the sector as well as calls from experts in the area.
Did you put as a budget bid to the Treasurer did you put this as a priority?
Oh, look, certainly every minister puts proposals to the Expenditure Review Committee, and not all ministers get what they ask for. I can't go into cabinet and confidence discussions, obviously, but that is part of the budget process. I am very pleased that what we did last year was we made an absolute commitment to emergency funding and filling huge gaps across New South Wales of where there were no services for women and children leaving domestic and family violence, where there was no capacity for women and children to be able to have safety upgrades provided, have case management provided. Staying home, leaving violence does that. Is there more to be done? There is absolutely more to be done.
Yeah, and
There
even
is
in that
no
expansion, it wasn't an expansion per local government area in funding, it was an expansion of the program. And I appreciate that, but when the program was already underfunded to the point of being unsafe in some areas, again, this is staying home, leaving violence is not adequately funded either, is it?
Staying home, leaving violence is now right across New South Wales.
But is it adequately funded in every area?
single local government area.
You would say it's completely adequately funded, and so if we have another death from a woman who has not got the support she needed under that scheme, then that's not the fault of the scheme?
I can say, is there more to be done? Absolutely, there is more to be done. And this government is committed to doing that.
New South Wales had the highest rate of gendered murders last year. Again, I think this is the 9th time in 15 years or something. Don't quote me on that, but we were the highest. Our rates of domestic and family violence continue to go up on a per incident basis. It is clear that we have not done enough to push back on this crisis. I understand you have done something in this government, but are you sitting here today and telling us that you think that this failure to fund the core asks of the sector is actually acting on this crisis?
I'm saying that I'm agreeing that there is certainly more to be done, but this government has made absolute inroads into doing work that has never been done in New South Wales. A primary prevention strategy. We are implementing a risk framework that will be available to non-specialist workers that will assist, that will help people as they first identify that they're experiencing domestic and family violence,
and again,
no
I'm
matter
not
where
taking
they
away
are.
from you having done things, but it's a drop in the ocean compared to what's required. Is the problem that the Treasurer and the Premier aren't listening to you and the sector when it comes to this issue? Are they just not seeing it as a priority?
Well, I think the Premier made very clear that he was listening and he was hearing what the sector was saying.
Maybe we have a different definition of listening. You can listen, you can hear the words being said, but if you don't then act on the words being said, how is that listening?
Like I said, is there more to be done? Certainly. This government, though, has been doing work in the last 2 years since we've came to government, work that has never been done before.
Yeah, and again, not taking away from that, so.
Thank you, that's okay. Minister, across New South Wales there is currently no single statewide policy that protects biological women in contact or combat sports from competing against biological males who identify as women. State anti-discrimination laws protect transgender participation, and many sports adopt national or international inclusion guidelines that rely on gender identification or hormone thresholds rather than sex-based categories. In combat sports, the Act and regulations regulates medical fitness but has no gender-specific protections. Football New South Wales, for example, follows national human rights-based inclusion guidelines, with testosterone thresholds applied only at the elite level. Athletics New South Wales and school sports use a case-by-case framework. Unlike World Rugby, the International Mixed Martial Arts Federation, or World Boxing, which have adopted policies to safeguard female athletes internationally, New South Wales has not implemented equivalent protections. Minister, can the Minister for Women explain what measures and protections are in place to ensure the safety and fairness for biological women in New South Wales contact and combat sports, particularly in circumstances where biological males who identify as a woman seek to enter or participate in these competitions, particularly and potentially creating significant physical risks to biological female athletes?
It is this government's view that it is important that women of all backgrounds are safe in the places that they go to. In relation to sports in particular, it is our view that the sports are the best, they have the best expertise to determine the nature of competition in their individual sports. And I think that is a view that is taken not only just within New South Wales, but in many sports right across the world, that it is that the sporting bodies themselves who have the expertise to best determine the nature of competition in their sports.
So how is that protecting biological women in contact sport in New South Wales?
Well, as I said, it's our view that sports themselves have the expertise to determine the nature of who can compete within their sports.
I think, with respect, Minister, every sport is doing it slightly different, and that's really what I was saying. Many don't do it at all. Is it your view that it's then, therefore, for those sports that don't regulate it properly, it's quite okay for biological women to compete against biological men? In contact sports in particular, that's what I'm talking about. Boxing,
Well,
for example. Seeing women get knocked out by biological men in female sports.
well, as I said, it's our view that they're best placed, that the sports themselves are best placed. They're the ones with the expertise. They're, they're best placed to develop the guidelines.
It's not working. I mean, how is the New South Wales government balancing anti-discrimination laws with physical safety and competitive fairness for biological females? Athletes.
Well, we are complying, and it's our view that the sports are complying. And if it comes to our attention that they're not, then we'll look at it. But at the moment, it's our view that the sporting organisations are best placed to develop the guidelines that govern the way that their sports operate and who can compete in them and against whom.
But as Minister for Women, are you saying you're also Minister for biological men as well, acting as women?
I am the Minister for Women.
So what's the definition of a woman?
Mr. Borzak, I think what I said at budget estimates last time still holds. It is our view that women are able to participate in sport. They should be able to participate in sport, and it's the sporting organisations themselves who have the best expertise to determine what guidelines they use to determine the safety of their sports.
Well, Minister, have you actually sought advice and consultation with biological female athletes regarding the safety and fairness of contact sports that they're participating in?
This government talks to sporting organisations on how they ensure safety within their sports. That is something that the Office of Sport, my understanding is that's something that the Office of Sport does. It's not something that my portfolio deals with. Sporting organisations are within the purview of sport.
You're meant to deal with women's safety. We're just listening to my colleague here talk about domestic violence in the home. I'm talking about the potential sporting violence on the football field, in the boxing ring, in any other place where trans women are quite likely to participate. And the government is, in my view, seems to be, from your answers, vacating that space. Why are you doing this?
No, we are certainly leaning into women participating fully in sport. That is exactly what this government is doing.
Yeah, but not against trans women.
We're committed
Surely.
to promoting inclusivity, and we are ensuring that through what we do as a government, that women can participate in sport in an inclusive and a fair and a safe way.
Well, again, how do you ensure that participation of biological males in women's contact sports does not endanger female competitors? And the right answer is not to say you're leaving it up to the sports, with all due respect, Minister. The Anti-Discrimination Act allows this to go on. Do you think that that's fair? What if someone gets injured?
Well, I actually differ. It is our view that the sports are the people, the sports are the organisations with the expertise to determine how to ensure safety within their individual sports. And that is what we hold sporting organisations to. They are the ones with the expertise to ensure safety within their sports.
So do you think you should be reviewing this at some stage? If you're getting bad outcomes for biological women?
Well, I'm not sure that we are getting bad outcomes for women
You're not?
in sport. I actually think that we're getting more women involved in sport right now. I think the participation of women in sport, and in particular in non-traditional sports for women, is absolutely growing. And we're supporting that by increasing the ability for women to participate in sport, grassroots sport, and also right through the administration. The Minister for Sport is leading that strategy, and I think it's great work.
I applaud your efforts in relation to getting women involved in sport, and the more the better as far as I'm concerned. What I don't applaud is the fact that non-biological women can participate in sport, any of these sports, almost at will, and there is no single rule running across all sports, probably which should be governed by the Anti-Discrimination Act and amendments there too, that would stop non-biological women competing against biological women. And the current settings, do you agree, would allow more of that?
As I said, it's our view that the sporting organisations are the best placed. They are the ones with the expertise to determine how to ensure safety within their sports.
Minister, are there risk assessments or medical fitness protocols specific to sex at birth or physical advantage in New South Wales contact and combat sports that you're aware of?
I'm not aware of that. That's probably a question that would be best directed to the person who has the portfolio of sport.
Portfolio of sport, okay. And how are New South Wales sporting bodies, including Football New South Wales, Athletics New South Wales and school sport associations, monitored to ensure female safety in contact and combat sports?
Again, that would be a question that would be best directed to the Minister for Sport.
And you don't believe that that's something that should be regulated?
I'll go back to my answer in relation to the oversight of participation in sport, and this government believes that sporting organisations themselves are the best placed. They are the ones with the expertise to determine how to ensure safety within sport.
Okay,
and
thank you.
who can participate.
Thank you very much. Thank you, Minister, and everyone for being here today, particularly with the terrible weather outside. First of all, I just want to say the appointment of Karen Webb, she's certainly qualified, and I will turn to the detail of her work a little bit later. But before that, I wanted to actually ask a bit about the appointment process. Yep. On what date was it decided that a special advisor for domestic violence was needed?
Look, I will go to my involvement in this role. That's what I can speak to. I had a meeting with the Secretary of Cabinet and the Secretary of Department of Communities Justice on the 15th of May, who came to me and bringing to my attention that that Karen Webb, as the retiring police commissioner, was interested in doing work in domestic and family violence space, and I knew Karen's work in that space. It's been absolutely amazing work. So I agreed that I'd like to explore that more fully, and we did that over the next couple of weeks.
And who actually made the decision about the creation of this role? Was it yourself or was it the Premier?
It was, well, I made an offer to Ms Webb following discussions between myself, the Secretary of Cabinet, and Mr Tibble.
I understand that you made the offer, but who came up with the idea of a special advisor?
I'll hand that to Mr Tibble.
I'm happy to supplement the Minister's response. So just in terms of chronology, Ms Webb gave notice of resignation in May, with her resignation to be effective 30 June, and with an eye to transition of leadership in the police, it was proposed that she, or agreed that she would move aside from formal duties on the, I think from memory, the 7th of June. It's my understanding that in her letter of resignation that she alluded to the possibility of doing some meaningful project work, potentially in this realm of domestic and family violence. As you're probably aware, that the task force, co-chaired by the Chair at the Cabinet Office and myself, was moving into a new phase, and there was work coming out of that. So it really was in that context that the Secretary of Cabinet Office and I then met with Minister Harrison and scoped out what work might be undertaken, and discussions occurred, very much focused around the common approach to risk assessment and safety framework. And there are others who can speak to the heart of and substance of that work today, but essentially that was the involvement which the Minister and I had. I wrote to the Minister to scope out what I thought the role might be on the 3rd of June, and it was very much focused on that question of the CARIS and how that might be advanced through the work of a special advisor.
And Minister, does she report directly to you?
She is working within Department of Communities and Justice. I have met with Ms Webb on a couple of times, on a couple of occasions. I think that it's important that the work that she does is really working tightly in conjunction with Department of Communities and Justice. She is a special advisor to me, and she will be providing a report to me at the end of the work that she does. But from an operational, from a day-to-day point of view, she doesn't sit within my office. Mm-hmm. She sits within Department of Communities and Justice.
And so is the salary out of the domestic violence portfolio budget or another budget?
My understanding is that her salary is still coming from New South Wales Police, because she is still employed on that payroll.
And Minister, were any other candidates considered for the position?
No.
And does she have other staff that work to her in this role?
I don't believe so, but I'll get further details from Mr.
Yes,
from
so
Mr. Tibble.
she is working closely with our existing team who are represented here today. There was a range of work in support of the DFE task force that was ongoing. There then was work to continue. Ms Webb is an additional expert and resource to drive that work, but works alongside those staff who are currently employed doing that work.
And a bit later on, I'll go into the detail of the risk assessment that's being done. But her contract will finish. It's a 3-month contract. Is that correct?
The work that she's doing for the CARIS will finish at the time that her contract finishes. That's correct.
And when is that?
30th of September.
September. Do you intend to continue a special advisory role?
No.
And you're confident that the work that she's been assigned will be all completed by then?
Yes. I'm looking forward to receiving her report.
And when's that report due?
Well, obviously before she finishes up on the 30th September.
And will the report be made public?
Look, I hadn't thought about that.
I mean, we can I just say, I would consider that there would be nothing at all confidential about the work being used to advance evidence-based, user-tested frameworks in the space of assessing and more effectively managing risk in this, highly complex area. So I've not been a party to discussion about that, but there is a real need for that to add to the body of knowledge that we have and we need to keep developing.
Okay. Thank you.
I think the work that Ms Webb has been doing has been particularly in relation to looking at the experience of other jurisdictions in relation to what they do for more general risk frameworks. And that's really beneficial work. So, I mean, there may be a need, depending upon the nature of the advice that other jurisdictions provided us, to not put everything out in the public, but I wouldn't think that there would, as Mr Tipple said, be any reason to not provide as much openness as we could on that.
No, that's great. We look forward to seeing it. Thank you. I might move on to the Boxcar results, the March figures. And you'll be aware that there's been a 3.6% increase in domestic violence-related assaults over the last 2 years, and that domestic violence-related murders have also increased, and my colleague touched on that as well, including 11 children who were victims of domestic violence murders, which has been the highest recorded in over 10 years. Last year, Minister, I asked about what you were doing, and you said, and I quote, you're looking at the drivers, what drives someone to use violence. Could you now outline what those drivers are?
We're still working on the strategy. We haven't yet released the strategy in relation to people who use violence. I'm really looking forward to releasing that before the end of the year, but that work is still being finalised now.
Do you think...
Mind you, we know that there are a variety of different types of drivers. What we want to do is understand which drivers drive which type of perpetrators to use domestic and family violence.
Mm-hmm. So do you think that your investments in the domestic and family violence space is actually delivering results?
Look, I think this is long-term work. It's hard work. We are seeing increased reporting rates. We're also seeing, according to the Australian Bureau of Statistics, that the rates of self-reporting in relation to experience of domestic family violence are stable in New South Wales. That is not good enough because we want to see those rates go down. While we're seeing increase in reporting rates, that could mean a variety of things. It could mean, as Boxcar has indicated, that people are more likely to seek help and report. But that's not to say that there is absolutely more that we need to do and more that should be done.
Minister, in the budget papers, it actually refers to that victim experience surveys are more representative of community experiences rather than some crime statistics. Why is that?
Well, for that very reason that I just indicated, and it's something that Boxer is clear on with their most recent report in relation to domestic and family violence, where people feel that it is more acceptable to report domestic and family violence, where people feel that community is more likely to not shame them, to not make them feel guilty for their experience in relation to being a victim, they are more likely to report. That could be a reason.
So what are you doing to capture these experiences and surveys to get a more accurate data? As you said, the information we're currently getting from Boxer is showing stable or it's going up, so it's obviously clearly going in the wrong direction. You've said in the budget papers that surveys and people's experience is extremely important, so what are you doing to capture that?
We're in the process of developing a data strategy. There was funds committed to a data strategy in this year's budget, and that'll be one of the key things that will help us better understand what is being experienced in relation to domestic and family violence, how those Australian Bureau of Statistics relate, how the Boxer figures relate, how the reported rates relate, and also how where we need to spend our money where there are particular gaps.
And what's the time frame? So you've got a data strategy coming, you've got a driver's strategy. What's the time frame that we can start seeing the statistics go in the different direction?
Well, as I said, the people who use violence strategies should be released before the end of the year. I'll just need to get advice on when we're likely to see the data strategy released.
My question is specifically when you expect to start seeing these trends go in the different direction. I understand releasing strategies and lots of papers, and there's lots of strategies and plans and reports, but when are we actually going to start seeing some real results?
Look, I'm sure that there is always more work to be done.
I understand that.
I can't give a definitive figure on when we will see domestic and family violence rates decrease. We are committed to seeing them decrease, and we are doing work now that has never been done before by New South Wales Government to really work on not only supporting victims in having a safe place to go when they experience domestic and family violence, and not only when victims need to reach out for specialist support, but also to change the attitudes that drive domestic and family violence. It is long-term work. We can do short-term work, providing someone with a safe place to go, but we also need to do that long-term work in changing people's attitudes and behaviours. So I can't give you a definitive date in the same way that previous governments could never give people a definitive date of when rates were going to go down.
And I go back to my original question, Minister. Do you think that your investment in domestic and family violence is actually delivering results?
Look, I think that, as I said, it is long-term work. It is hard work.
Have you adequately funded the portfolio?
Pardon?
Have you adequately funded the portfolio? Is your government seriously investing in domestic and family violence prevention?
I'll go back to what I said to Ms Boyd. Is there more work to be done? Absolutely, there is more work to be done. But we're committed to doing it. Minister,
are you concerned that ADVO compliance checks have dropped from 113,509 in March 2023 to 96,250 in March this year? And what action have you taken to address this?
Look, ADVO checks, that's a question for the Minister for Police.
Have you spoken to the Minister for Police?
I speak to the Minister for Police on a regular basis in relation to particularly domestic and family violence.
And have you raised this?
Look, I talk to the Minister for Police on a range of matters, as I said. and we're both really working hard to make sure that victim survivors are supported, that perpetrators are held to account, as is the Attorney-General, and that we drive down the rates.
Minister, you said you speak to the Minister for Police regularly. Did you talk to her about Ms Webb's appointment?
The discussions that I've had in relation to Ms Webb's appointment are particularly in relation to the work that was going to be done in DCJ, and I'm really pleased with the work. I'm excited to have Ms Webb working for me.
So what you're saying is you're able to talk to the Minister for Police about the future work of an advisor, but you can't talk about the declining ADVO compliance checks.
I did not say that at all. I said I talk to the Minister for Police about domestic and family violence on a regular basis.
And have you raised this specifically and asked what's being done?
Well, the Minister for Police is very clear on things like Operation Amarok, but the detail you have to ask the Minister for Police.
Minister, the Far West and Arana region have the highest rates of domestic violence assaults in the 12-month period to March 25, 3 times higher than any other area. What targeted initiatives have you implemented to address this alarming rate?
Regional New South Wales, including the Far West and Central and Arana areas of New South Wales, in fact, regional New South Wales have higher rates of domestic and family violence than Metro. And that has really been the case for some time now.
But I'm asking, Minister, what specifically have you done to address this significant rise, which has clearly been reported?
Well, expanding staying home leaving violence was a significant improvement to ensuring that there are services available to people.
But that was statewide. I'm asking specifically for this area.
Do we have any detail on that area, on this area?
I can take that on.
Take that on notice. In the remaining time that I have, Minister, can you explain what the term multiple intersecting diversity dimensions is? And this relates to the strengthening domestic and family violence workforce development strategy you released this morning. Would you like me to repeat that?
Yep.
It's called the multiple intersecting diversity dimensions.
Yep. Okay. So what that relates to is that where there are different aspects of diversity, so gender, multicultural background, Aboriginality, LGBTQI+, disability. All of those are particular areas where there will be additional challenges experienced in relation to support and experiences of domestic and family violence, and where a person experiences one or more of those, there are multiple intersectional aspects of diversity.
And then can you explain how these different dimensions of each person will come together, which is in your document?
Well, exactly that. Somebody may be.
Is it one person or multiple people?
One person may
Well, it
be.
says here that these different dimensions come together to form their particular identity. And this is for each person, it says.
That's right. Yep. So somebody could be female, they could be of LGBTQI background, they could also have a disability, and they
Minister,
could be from a
confusing.
multicultural background.
It all sounds very confusing. Minister,
Well,
my
I'm
question
sorry if
is,
that's confusing for you,
do you
but some people
intend,
experience all of those
Minister, do you
diversity
intend to
aspects.
remove the Minister for Women and replace it with the Minister for Identity?
Pardon?
Do you intend to remove the Minister for Women and replace it with the Minister for Identity?
Oh, I think that would be I don't choose what a portfolio is named. That is an issue for the Premier. However, I am, as the Minister for Women, quite proud of the fact that as the Minister for Women, I have a portfolio that represents women in all the diversity.
Thank you, Chair. Let's talk then a little bit about one of those intersectionalities, actually. I understand that a New South Wales Aboriginal domestic family and sexual violence plan has been or is being developed by the Department of Communities and Justice. When will that be ready?
Yeah. Thank you for that question. This work has been, it's important that what we do in doing that work is make sure that we do it in deep consultation with First Nations people. We don't want to be bringing a strategy into place where it is not absolutely co-designed by First Nations people, so we're taking our time with it. But I might get some advice on whether we have a time. What time frame
Estimated at the end of this year.
Yeah. Okay. Is the Aboriginal Affairs team engaged in the development of the plan?
They will be one of the stakeholders that are being included. The work itself in relation to the First Nations Family Domestic Violence Plan is being driven by Transforming Aboriginal Outcomes.
Together with ALS as well.
Okay,
Yep.
Thank you. I understand that the Transforming Aboriginal Outcomes, the TAO team, had advocated for $40 million for the implementation of the plan. The New South Wales Government has announced funding of $2 million. What is the intention, I guess, over the life of the plan to ensure that it's effectively implemented? Will it be funded sufficiently?
Look, as I said, we're still developing the plan. Until the plan is finalised, it's really hard to determine exactly what funding will be required for it. Once the plan is finalised, we'll certainly be making sure that it's sufficiently funded.
The Domestic and Family Violence Workforce Strategy was released this morning, as my colleague has said. So you'll forgive me if I have not digested it sufficiently in time to ask you questions about it. I guess from a sort of a layperson's approach, when you're looking at this issue, if you have people who are currently working in the sector who are experiencing huge levels of demand for their services, they are underfunded, they're dealing with that moral injury of being in a sector where they're there because they want to help people, but they're seeing people not getting the help they need because there's insufficient funding. How much worth is a workforce development strategy when we're not dealing with that core funding issue first?
Oh, I think they go hand in hand. As you'll remember, the workforce strategy has been something that has been committed to for a while by the government, but also really called for by the sector. They've been really wanting a workforce development strategy because of the issues in relation to workload, the issues in relation to the stress that they experience, partly because of workload, but also partly because of the nature of the work. Nature of the work that people who work in the sector find incredibly rewarding, which is what they tell us, but also that is stressful. So the workforce development strategy is really aimed at, and what it will do will make sure that we have a workforce that is well supported, particularly in relation to having a safe workplace, and make sure that there is good clinical supervision, to make sure that there's a good pipeline of workers coming through, and really also to make sure that the sector itself works well together and shares ideas, and that system collaboration.
I'll give you an example. I think last year went to see one of the frontline services in Tamworth, and they were telling me that because of their location, to even go and get training, which tends to be in the city, a person, a worker would have to take a couple of days off of work to go and get training, whether it's in sort of core work functions, or it's in resilience, or it's in whatever else it happens to be. When they take those 2 days off, to go do training, there's no one able, because of the lack of funding, to then step in to look after their clients. They feel this real stress of being unable to have respite, to have training on some basic issues that might help them because of that underfunding. It's leading to burnout and real stress in the sector, at the same time as we are putting on these services obligations under the Respect at Work reforms to ensure that there are really sort of safe and healthy workplaces. So there's these competing factors going on here, and what you're ending up with is these workers in the middle who are being really stretched, and organisations being unable to provide them with the psychological support that they need. Have you considered that in the context of the workforce strategy?
Certainly, we're looking at what we want to do is do further work, and Ms. Campbell might want to talk to this a bit more. But we want to make sure that options are available for services so that they can provide the training that is needed, and whether it be online training, what form of training that might take. The workforce strategy really wants to further work with the sector on what forms the training might take and how best we support the workforce during a time that, clinical supervision is important.
Yeah.
And what we'll be doing is, separate to a training, also developing a best practice clinical supervision guide. So there's a range of ways that we want to support the workforce in dealing with the challenges they have in keeping up to date with legislative changes that are being made, coercive control, all of those kinds of things, what we're doing in relation to the CARIS, and also how they can participate in training.
And all of that is great. And in an ideal world, you said before you recognise that people working in this sector are working in a inherently stressful sector. They're dealing with people who they're trying to save from violence. They're trying to save from. Sometimes they're trying to save their lives, and a lot of them have to deal with people dying who being murdered, who they have been dealing with. It is incredibly stressful, and good workplace, health and safety strategies would have us being able to give those people respite, giving them time to go to therapy sessions, do the things that they need to do. But what we're hearing, and what I'm sure you're hearing on the ground, is that these services are so under-resourced that they're not able to do that. And so we're sort of adding injury upon injury. Was that considered as part of the workforce strategy? I feel like, a strategy on paper, when you're incapable of actually putting any of it in place because there's insufficient funding, it's kind of almost adding insult to injury.
The issue in relation to clinical supervision guide is an important one in this space. It doesn't deal with everything that you're raising, and I'll ask Ms. Campbell to talk about further what options were considered in relation to the workforce development strategy. But the clinical supervision guide is really important to ensure that, because what we heard is that there are gaps in relation to clinical supervision, and we want to make sure that everybody is on the same page when it comes to how best to support and
I'll come back
provide
to
that
Ms
professional
Campbell
supervision.
this afternoon. Just in my last few seconds, I just want to ask you, Lucy's project was asking for funding in order to not close their doors. I understand they didn't get any funding in this budget. They were looking for $2.3 million over 3 years, which is quite a small amount comparatively, in order to continue operating. They didn't receive that. Are you concerned that there will now be a gap, particularly in the advocacy, but also in that, in the sort of direct frontline work that they were doing in relation to that connection between domestic family violence and animals and animal abuse?
The work that Lucy's project has been doing has been a really valuable service. As you mentioned, unfortunately, there were no funds available for the organisation through my portfolio. They weren't previously funded through this portfolio. We provide funding through Staying Home Leaving Violence and Integrated Domestic Family Violence Service for pets, in particular for vet costs and emergency accommodation for pets in relation to domestic and family violence. And as you'd probably be aware, the new refuges that are that are being provided across New South Wales, 10 of which are up and running now, are required to have pet-friendly facilities.
Thank you.
Thank you. Minister, does the New South Wales Government recognise any gaps between international protections for female athletes, e.g. in World Rugby, IMMAF and World Boxing, and New South Wales sports policies? You were saying that basically the industries regulate themselves in relation to...
Take a point of order, sorry. This is, I think the Minister's already raised this issue. This is outside the portfolio area that we're inquiring into today. This is a sport-related inquiry, and therefore that question is out of order.
I'm sorry, I can't hear you.
I said this is a sports-related inquiry that you're making. This is outside the terms of reference of this specific inquiry. If you have questions in relation to the Ministry of Sport, they should be directed to the Minister for Sport,
Well,
not to the Minister for Women.
To the point of order, this is a ongoing line of questioning in relation to trans women's participation in sport and how this government, through the Minister for Women's Affairs, actually manages that situation. And the Minister's given continually answers that say the sports will regulate themselves. And the last part of my question says, how does that run with the New South Wales Government's policies in relation to regulating trans women in sports? Now, I would think that the Minister for Women should have a view on that. That's entirely reasonable, isn't it?
Well, my initial point remains it's a question that relates to the portfolio of sport and should be directed to the Minister for Sport, not to the Minister for Women.
Anyone want to make a contribution?
Well, I'd suggest, Chair, that it's also about women in sport, trans women in sport.
And that wide latitude's given during budget estimates, but we're wasting time.
Well, I'll rule on myself. There's no point of order. Thank you. Minister, would you like me to repeat the question?
Certainly.
Certainly, okay. Does the New South Wales recognise any gaps between international protections for female athletes, e.g. World Rugby, IMMAF, World Boxing, and New South Wales policies as they relate to trans women participating in sport? In other words, what's the government doing to protect biological females? That's the line of my questioning that I'm continuing from my first 10 minutes.
Yeah, so in relation to does the government recognise any gaps between international and New South Wales practice, that is not something that my portfolio has been dealing with. It's not something that New South Wales has been dealing with. That would probably be something that the Minister for Sport and the Office of Sport would deal with.
Well, my next question was going to be, would you consider introducing a statewide policy to explicitly protect biological women in competitive contact sports?
Look, I think I'll go back to my previous statement, and that is the New South Wales Government is of the view that sporting organisations have the expertise They are the ones with the expertise on to determine how their particular sport, how safety is maintained in their particular sport for all participants, whether that for a range of participants.
I get the answer, Minister. I've had it about 10 times so far, but
I'm sorry, I
how does
can't
that
provide
protect
anything
women,
further for you.
biological women from biological men participating in those sporting programs when they are obviously they're bigger, they're stronger, etc., etc.
And it'll depend upon the sport as to whether that is an issue in relation to competitiveness and safety. And as I said, it is the government's view that their sports are best placed to determine that. And that's actually probably the case internationally. If you look at what is happening...
Well, it's not necessarily internationally at all in that way. There's no... What I'm saying is that there is no consistent approach across the world, and you're saying, well, we'll rely on that inconsistency over the various sports to protect biological women. That's what you're saying. Am I interpreting what you're saying correctly?
Well, I'm saying that the sports are the organisations with the expertise to determine the safety within their sport.
So I suppose the next question is, Minister, are you the Minister for Women and Trans Women?
I'm the Minister for Women.
Okay, not trans women. So if violence occurs in the home, you are properly
I would say that
But if it occurs on the sporting field, you leave it up to someone else to think about.
Mr. Borzak, I would say as the Minister for Women, I am the Minister I am the Minister for Women, and this government views that women include trans women.
So you're the Minister for Trans Women too then?
Yes.
I'm the Minister for Women.
So I don't understand that answer.
I suppose we're coming at it from a different point of view.
Maybe it's just me.
My view is
Maybe
a
it's
trans
just me.
woman is a woman.
All right. Just moving along. Domestic violence and sexual assault. I'd like to speak about domestic violence and the measures the government is taking against it. The figures are always upsetting, of course. Roughly 24% of women, 1 in 4, experience domestic violence, and 14% of men report experiencing domestic violence. That's an important distinction because it's almost universally agreed that men underreport domestic violence and the incidence may be as high as 18%, if not higher. So that's approaching 1 in 5 men. Many don't report for fear of ridicule or that they could be called liars. Minister, could you please speak about programs that exist for both men and women who experience domestic violence?
So for both men and women, or would you like me just to focus on the programs that are available for men who experience domestic and family violence?
I'd like you to focus on the programs that are available for men and women in the domestic violence space.
Okay, so there's actually we have a program called Safer Pathway, and Safer Pathway is an important. It is the way that we ensure that people who report domestic and family violence are provided with the support that is needed, that they need. So if a woman reports domestic and family violence, whether it be to police or whether it be to the 1800 respect number or the domestic violence line, they get risk assessed by police if it comes into police. Then that is referred to the Women's Domestic Violence Court Advocacy Service for them to do a risk assessment and to determine service, or to refer to services. For men, again, police do a risk assessment in relation to a man who has reported domestic and family violence. And then as well as them doing their risk assessment, it is referred to, instead of what happens in a woman's case where it gets referred to Women's Domestic Violence Court Advocacy Services, a man's case will be referred to what we call local support services. And local support services are provided across the state by various non-government organisations. And those support services, again, do the risk assessment that they did a risk assessment for a man that would have been done by the services providing women's domestic violence court advocacy services for a woman.
Right, so what's being done to address this significant problem of male victims underreporting?
We are really, community awareness programs are important. And we, in our community awareness programs, have made it clear that anybody can experience domestic and family violence, anybody can experience coercive control. It is not exclusively women who are victims, that it can affect everybody.
Can you, and maybe you can take us on notice, name some of the community support organisations supporting male domestic violence victims?
Certainly can take that on notice. We might even be able to get advice today for you.
Definitely, I've
Yep.
got it here.
Yep, okay. So local support services, Relationships Australia in the Canberra region provide local support services for the Murray and Riverina, the South Coast. Arana Support Services provides the local support services for men in the northwest. Orange Local Aboriginal Land Council provides local support services for men in far and central west. The Family Centre provides local support services for far and the mid-north coast. Catholic Care Social Services Hunter Manning provides local support services for Central Coast and the Hunter. Caretakers Cottage provides it in the Sydney area for local support services. Interrelate provides local support services for St George and Sutherland, Northern Sydney, Nepean Blue Mountains. Sage Community Services provides local support services for Western Sydney, Northwest Metropolitan and Western Sydney, Southwest Metropolitan. And Muslim Women Australia provide local support services for Southwest Sydney.
Thank you, Minister. Opposition.
Thank you very much. A recently released Australian public health study estimated that nearly 9,120 women become homeless each year due to domestic violence. Your government's announced, said that they'll have 50% of new social homes will be allocated to victim survivors. Of the 1,700 announced on the 30th of June this year, how many were allocated to victim survivors?
I don't have that detail. That is detail that would be held by the Minister for Housing and Homelessness.
And when was the last time you asked the Minister how she's tracking on delivering on that commitment?
I don't have the detail of that.
Have you ever asked her?
The Minister for Housing and Homeless and I speak regularly on issues in relation to women's homelessness, and we meet with services as well who are working in that space.
Yeah. And have you actually asked how she's tracking on delivering on that government commitment?
We've discussed how the government is tracking on that commitment.
Do you ask for regular updates, or is it provided to you?
There is information provided to my office on a reasonably regular basis by that.
Well, maybe before we finish this morning's session, you could ask your office to provide you with the latest update and what date that was provided to you.
I think the issue in relation to women in homelessness services is an issue in relation to that should be asked of the Minister for Housing and Homelessness. That is the best way to get the most updated information in relation to that.
But you're the Minister for Domestic and Family Violence Prevention.
Yep.
It would be in your interest to know how many homes, social housing homes, that your government announced are actually going to victim survivors. This is not about crisis accommodation, this is about transitioning into stable accommodation.
That's right, and that is under the Minister for Housing and Homelessness's portfolio.
So you don't take an interest whether or not that's being delivered?
I take an interest, but the Minister for Housing and Homelessness has responsibility for that area.
And I've asked you, and I'll ask you again, have you received an update?
Have you
even asked?
I receive updates on a regular basis.
And I'll ask again, can you provide the latest information you've received from the Minister in relation to women and children escaping violence in social housing? How many of that 1,700 have been allocated? You said your office receives regular updates?
To get the most up-to-date information, it would be better to ask the Minister for Housing and
No, I'm
Homelessness.
asking when you received your last one, and you said your office receives regular updates, and I'm asking when was the last update?
I'll have to check that.
Okay. Now, Minister, the Minister for Homelessness announced the Housing Innovation Fund, 22 providers. Only 7 of those organisations that received funding went to supporting women and children escaping domestic and family violence. Do you agree with that decision by the Minister?
Sorry, could you repeat that?
The Homeless Innovation Fund, you'd be aware of that?
Yeah.
And it is the responsibility for Minister Jackson.
Yeah.
22 organisations received funding. Out of that funding, 7 went to organisations that support women and children escaping violence. I'm asking whether or not you think that is adequate. Do you support the Minister's decision to only allocate 7 out of 22 to support women and children escaping domestic violence?
I support the Minister's decision. I know that the Minister is absolutely working to ensure that women and children who are facing domestic and family violence have safe places to live in on an ongoing basis. It's an issue in relation to housing and homelessness, it's an issue in relation to planning, and it's an issue in relation to my portfolio for...
But only 7 out of
emergency
22,
accommodation.
you think that's adequate? You think that's enough to support women and children escaping violence? Or should she have done more?
This is an ongoing program, and that is not the only thing that the Minister for Housing and Homelessness is doing in relation to supporting women and children experiencing domestic family violence.
Well, you can see the concern here where your government's committing 50% to social housing properties. You have no idea what that number is and whether or not they're actually even meeting that target. But what we can see of the Innovation Fund allocation, far less than 50% went to supporting women and children escaping violence. Again, I ask, are you actually doing anything to ensure that your government is delivering on their commitment to support women and children escaping domestic violence?
Absolutely. All you need to do is look at the work that we've been doing.
We
in
see the
relation
strategies and the plans and the reports, but this is actually about tangible projects, funding that not only supports them escaping, but actually ensures they have long-term housing, and you have no idea what your government's doing.
Well, that's not true. What I'm saying is that for the best information in relation to that, if we're not talking about emergency accommodation for domestic and family violence victims, and if we're not talking about specialist services that are being provided for domestic and family violence victims, then the best place to ask that question is the Minister for Housing and Homelessness, and her budget estimates, my understanding, is tomorrow.
Will you commit to actually asking for regular updates in relation to social housing and the target of 50%? So that you can give the sector a commitment that you're actually monitoring this.
As I said, I receive those reports.
And will you provide that update to the committee by this afternoon?
I'll take that on notice.
Minister, the Core and Cluster program, which was funded under our government, how many are actually completed?
There are 10 Core and Cluster refuges operating.
Mm-hmm. And how many have yet to commence construction?
I'll take that on notice and come back to you this afternoon. They're in various sort of processes at the moment, so I might get you a more accurate number.
Minister, of the 10 that are completed, are they all new builds or refurbishing of existing properties?
Some were refurbishing of existing properties. Some are actually like considerable refurbishing of existing properties, not necessarily. I can think of one, for example, was a refurbishment of an apartment block, and some are totally new builds, greenfield sites.
So have all contracts been signed for the 49?
Yes, I believe they have been.
But Minister, you weren't aware.
That's for the actual builds.
Minister, how many are being built using modular construction?
There have been 2 that I'm aware of that have been that have used or that are using modular construction.
Minister, should we be concerned that the Core and Cluster program, which is in your responsibility, you don't know the details of, and you certainly don't know the details about social housing and crisis accommodation? Are you across the detail of what supports around accommodation are being provided to women and children escaping domestic violence?
I am. I receive regular reports in relation to the Core and Cluster program and its implementation. I don't know where you made that assumption from, because you just asked me about modular builds.
I asked you about how many have been constructed. I asked you about how many have been completed. You were vague on the 10. Some might be rebuilds, some were refurbishments. You're not across the actual detail. And that's one part of your portfolio you are responsible for.
I think that you're actually taking I actually deny that I was vague on the 10.
Do you know where those 10 are? It's only 10.
Thank you. Yep. They are in the Bathurst local government area. That's being built by Housing Plus, through Housing Plus. Canterbury Bankstown local government area. There are 2 there. The City of Wagga, Cumberland local government area, and that's a project by Evolve Housing in conjunction with Women's Community Shelters and Parramatta Women's Shelter. Dubbo local government area, that's being provided by Housing Plus. Gunnedah local government area, that's being provided by Gunnedah Gunya Aboriginal Corporation. Hawkesbury local government area, Link Wentworth Housing, stage 1 of that is in place. Port Macquarie local government area, Community Housing Limited has been working with Liberty Domestic and Family Violence Specialist Services, and that is, I was fortunate enough to visit that service. And Penrith local government area, Evolve Housing, and that is one of the refurbishments of an existing apartment block that's been delivered with Women's Community Shelters.
Thank you. I might pass to my colleague. She's got a couple of questions.
Great, thank you. Good morning to you all. Minister, in the additional budget estimates hearings, you took a question on notice. You told the committee that the Queanbeyan Refuge in particular, to be built as part of the Core and Cluster program, was forecast to commence construction in May 2025. Has that construction started yet?
No, my understanding is that the construction is due to start by the end of this month. Obviously, weather is can be a problem, but my understanding is that it's on track for commencement by the end of this month.
So that's a 3-month-odd delay from when you stated last time. That's all due to weather, or are there other factors as part of that as well?
I need to refer that to.
Yeah, look, I'll come back this afternoon.
Okay, that'd be great. Thank you, Minister. Has the New South Wales government provided a funding increase to support women's refuges established prior to and operating outside of the Core and Cluster funding stream?
There have been increases to funds received by some of the refuges. For example, we have increased the number of, in partnership with the federal government, increased the number of domestic violence specialist workers in some of the refuges as part of the 148 specialist workers that have been rolled out across the state. We've also increased the number of specialist children's workers in refuges, not across the board. However, there are increases in specialist children's workers. And then obviously there's also increases like CPI.
Okay. Domestic and family violence services in regional, rural and remote areas, they don't receive a loading despite the additional cost they incur to deliver services, obviously across vast geographical areas. Will the New South Wales Government introduce a regional loading for all funding streams that provide domestic and family violence specialist services?
So the issue in relation to regional and rural remote refuges and the costs associated with the isolation is certainly considered through the procurement process. It might not actually be that we use a terminology like loading, but it is certainly considered during the during commissioning processes, and I'm happy to ask Ms Campbell to provide more detail in relation to that, but there is a recognition that there is increased expenditure in regional
So that's
New South
addressed
Wales.
in one way or another?
It is, and I can give you an example. Recently we've been developing the staying home leaving violence model out in Western New South Wales, and we've actually allocated a higher rate for those services given the rural and remote locations. So that's in those services are expected to commence in Burke by December, and then Walgett, Canamble and Kempsey and Nambucca LGAs as well. Okay. And it's been co-designed with the Aboriginal community out there. So it has a different name.
Great. Thank you. Just a couple of quick ones, please, Minister. You talked earlier about regional New South Wales having higher rates of domestic violence. So is the strategy that you referred to earlier in relation to drivers, are you specifically looking at why this is the case in regional New South Wales particularly as part of that strategy?
As part of the... So I just want to be clear about the work that we're doing in relation to drivers. So what I was referring to earlier is in relation to the people who use violence strategy. So it's really about particular groups of people who use violence. As a result, during those consultations, we certainly did consultations in regional, rural and remote New South Wales to ensure that particular nuances in relation to those areas were considered in relation to the use of violence.
But so you're not actually breaking down or doing an analysis on why there are higher rates of domestic violence in regional New South Wales, or strategies to address that specifically?
In relation to regional, rural and remote New South Wales, obviously those consultations will inform what is covered within that strategy. There is an absolute recognition that there are different types of issues faced in those areas, and that is something that...
So to break that down further, I understand that, but I'm suggesting that will there be given higher rates, will there be a prioritisation of what might be needed specifically in these areas rather than a carte blanche approach, one size fits all? Are we going to break down and see different strategies for regional, rural and remote areas given higher instances?
Yeah, I haven't been briefed on the detail of the people who use violence strategy recently, so I'll just refer that to Ms Campbell.
I mean, we have consulted with regional and remote parts of New South Wales on this strategy. We haven't actually briefed the Minister yet on the strategy, so I probably can't say too much further, but obviously we'd be looking at locations where there are higher rates of domestic and family and sexual violence and look at how we target services there. When we did the rollout of the emergency funding package, we've rolled that out to lots of locations in regional and remote New South Wales that didn't have any services on the ground, but I can come back this afternoon with examples of that.
That'd be great. And do you have an idea of when you will be briefing the Minister? Can we take it on notice to receive some information after that has occurred?
Yes.
Yep.
Yes.
That'd be great. Thank you. Minister, I've just been handed this, so the strengthening the New South Wales domestic and family violence sector strategy, and coming back to my previous question, it does state that in relation to regional, rural and remote areas do require a tailored approach to workforce development. Funding models do not adequately reflect local workforce challenges, access issues, and the complexity and cost of service responses in these areas. So therefore, this is suggesting that more does need to be done in relation to that. What is the New South Wales Labor government, what are you as the Minister doing to address that particular aspect of this issue?
Yeah, one of the really important things that I've been wanting to do since becoming Minister is to actually increase services where there have been gaps, and it's something that I've mentioned before. The increase in relation to staying home, leaving violence services across New South Wales is an important aspect of that. The increase in the number of specialist workers in relation to regional, rural and remote New South Wales is an important aspect of that. The increase in specialist children's workers is an important aspect of that. The fact that 36 of the 49 core and cluster refuges will be built in regional, rural and remote New South Wales is an important aspect of that.
But what about...
But there's more to be done.
Yeah,
there is certainly more to be done.
And workforce, Minister, specifically about the funding models don't adequately reflect the workforce challenges. So we understand that you're aware of these issues. Are there going to be strategies and actions that will specifically deal with what is being pointed out here?
Yeah, that'll be work that's done as part of the more work as part of the workforce development strategy. That's right.
So, and it's in this current strategy. So you don't have a timeline or what you're working towards, given that this strategy has only just been released today. Today.
Yeah. So one of the aspects of a strategy is about further understanding the workforce. And what we want to do as part of the work in this strategy is to really map and categorise the different parts of the workforce, what it looks like, what are the different workers, what work they do, and where they are doing it. So we want to better understand that, because there is what became clear during the specialist, during the 148 workers rollout was that we needed to have a better understanding of where gaps were, and this workforce development strategy will further inform our understanding in relation to that.
Thank you, Chair. Minister, I understand that there is a bunch of new core and cluster refuges that are being operated by specialist domestic and family violence services that have not previously operated such services. How are we ensuring that they comply with the Domestic Violence New South Wales Good Practice Guidelines?
Well, that is certainly considered in relation to whether they receive the contract in the first place.
But given that they haven't got a track record, what is the process going to be going forward to ensure that they are complying with those guidelines?
Yeah. Okay. Each district will be responsible for overshoring the oversight of the implementation of those refuges. I might. Do you want to go to Ms Campbell now, or do you want to take this afternoon about how that will actually happen?
Yeah, we have a kind of a part of my division now that transferred over in December called commissioning and planning staff, and they're based in local districts and they do all the contract management. So they're in place and they're the ones who have been negotiating the core and cluster contracts. So once the services are operational, they'll be doing regular monitoring of, against the standards, against the contract that services are being delivered. They also often, where there are issues with a particular provider or a service or a client has an issue, that we may get complaints, so we'll follow up and investigate those complaints.
Thank you.
Got another minute.
As Minister for Women, what steps have you or the New South Wales Government taken to support female firefighters by extending the list of presumptive cancers for firefighters in Schedule 4 of the Workers' Compensation Act 1987 to include cervical cancer, ovarian cancer and uterine cancer?
Oh, that's ongoing work that is being done, and it's work that is not being done within this portfolio. It's work that is being done. My understanding it would be it's being done by the Minister for Industrial Relations and the Minister for Emergency Services.
In the remaining time, Minister, could you list all the plans and strategies that are currently under your portfolio?
All of the plans and strategies that are currently in my portfolio. Well, we have obviously the women's strategy. I have the Ageing Well New South Wales strategy for seniors. I have the carers strategy. I have the domestic family violence strategy. Would you like me to keep going?
Happy to, and when all the report cards are due. Or if it's easier, if you could just provide a diagram of all the strategies, all the plans, and all the report cards.
I'm happy to take that on notice. I mean, I could.
That's fine.
Or I could come back after the break and provide you with a full.
No, happy for you to take
I'm
on
sure
notice.
I could take a full range.
Come back this
I could
afternoon.
take a long time. No, it could take a long time going through that.
No, I know the answer to that question. Government? No government questions? Okay, thank you. We'll now take a break and come back at 11:15. Thank you.
Thank you.
Thank you very much, Chair. Welcome back. Just ahead of the break, we were talking about core and cluster. I understand, so domestic and family violence quality standards were being developed by DV New South Wales with DCJ, is my understanding. And there is some mention in the workforce strategy, now that I've had the opportunity to glance at it over the break, that does refer to the development of those standards, of quality standards. Given that there's only, I think, $2.5 million put aside for the workforce strategy, how much of that will be used to fund the implementation of quality standards?
I don't have that figure.
I can come back this afternoon.
Is that $2.5 million across 3 years, or is it just for this financial year?
This financial year.
Just for this financial year.
Yeah.
Okay. So, because I understand that the sector were saying that I think ideally there should be around $10 million in order to implement it over 3 years. So, right. So there's a possibility then that we will see.
Yeah.
The additional $7.5 million coming in the 2 years after.
There was also $5 million last financial year for the strategy and for a couple of staff within DCJ and for training materials. So I think that's.
Okay.
But I'll come back this afternoon with
that would be useful.
greater clarity.
Thank you. Another issue that I've raised before that the sector has been concerned about is the failure to provide any new funding to existing women's refuges. So I understand, the previous government put in place the core and cluster funding stream, and that has produced some new refuges. But a lot of the existing women's refuges who have been embedded in their communities for a long time could also have expanded those services, and I know this was a sort of a point of contention under the last government. Minister, under your government, what additional funding is planned to be given to those existing refuges?
Yeah, I mean, that certainly goes to the point that you've been making in relation to funding for frontline services.
And here, sorry, just to...
But this is particularly for refugees you're talking
about.
Yeah,
so this is around capital investment, so infrastructure investment, not just the operational costs. So the funding I was talking about before is the sort of operational, that core baseline funding. Yep. This is in relation to the expansion of existing refuges.
Okay. Certainly there has been some funding for upgrades in relation to accessibility standards that have been required to be undertaken by existing refuges. There are some funds for some capital upgrades, not large-scale ones. That's not to say that in the future there may not be, but at the moment I can't specify exactly what might be in the future.
And just on those, the accessibility, I know that I mentioned last year there was a really damning report that came out saying I think 0% of the existing refuges and services were fully accessible for people with disability. What's that looking like now? What's the work been to date to address that gap? And have we got sort of better statistics coming out that you know of?
I don't have that on me. Might need to take
it on notice.
Yeah, Ms. Campbell's indicated I need to take it on notice.
Thank you. There was some confusion about the $272.2 million that was announced in the recent budget around exactly how much of it has been allocated where. Are you able to provide a breakdown of what those amounts are under the $272.2 million, and whether any of it is federal funding, continuation of existing funding, that sort of thing? Have you got
So, thank you. So what I have here is that of that $272 million, 25.3 million of that is over 4 years. Of that 25.3 million, $9.3 million is to implement serious domestic abuse protection orders that are coming in. $4.6 million to bolster electronic monitoring of high-risk domestic violence perpetrators on parole or ICOs. 8.9 million to continue and expand the pilot of DV Notify, which will provide notifications to victim survivors when their perpetrator is released from custody. $2.5 million over 4 years for staffing for the domestic violence line, so that they can continue, so that they remain open 24 hours, 7 days a week. And then there is $11.2 million for 1 year for the workforce strategy, $2.5 million for the workforce strategy, $3.6 million for the common approach to risk assessment and safety, $2 million for the Aboriginal family and domestic violence plan, domestic family and sexual violence plan, and $3.1 million for the data strategy.
Okay, so that takes us to 36.5 million. What about the rest of the 272.2?
I've got quite a detailed list here, so you're happy for me to go through that. I'm just trying to get rid of the ones, ministers. The DV Notify digital service pilot expansion. So this financial year 4.4, but over the forward estimates 8.9 million.
So that was already included in the 25.3.
Okay, sorry. Supporting marginal cohorts, maintaining program funding. So that's 4.6 million over the forward estimates, but 2.3 million this year. I'm not sure if you mentioned safe and strong families targeted early intervention and support. That's 21 million over the forward estimates and 7.5 million this year. Safe and Together frontline service delivery, which is delivered through New South Wales Health, is 0.7 million this year, and it goes to 1.4 million over 2 years. Our Justice Our Way program.
Sorry, can I just stop you there? Sorry, just because it is quite confusing, because the headline budget amount was 272.2 million. Was that for 1 year or 4 years? Because a lot of these ones now that we're listing are...
That was over 4 years.
So that's over 4 years.
Some of the programs may have been for...
Okay. I understand.
Some
Okay.
are 1 year,
Right.
some are 2 years. Yeah.
Which is why it's a bit... Yeah.
So it's not... Yeah, right. So we can't just say we divide it by 4.
No.
But it's still not... Okay, so it's not 272 million for 1 year. It's 272 million over 4 years, but in a sort of a lumpy way. Perhaps we will take the rest of that detail then on notice. So looking then at what the federal funding looks like, how much has been provided under the National Partnership funding? So how much have you received from federal government over the past 3 years, and how much has that been allocated, I guess, to domestic and family violence initiatives?
So over the past 3 years, and how much has been for domestic family violence?
Yeah.
So excluding sexual violence?
Yes. Yeah, do you have that? Again, you could take it on notice if you like. I'm just curious as to how much is coming through, and also whether any of that announced budget amount is just the New South Wales funding, or whether it includes amounts that have come through from the feds.
Yeah.
Yeah, I can, I hope, assist the committee. The agreement for 2025 to 30 over that 5-year period is 221.2 million.
221.2 million, 3 million for a 5 year.
221.2.
Sorry, 0.2 million over 5.
Over 5 years.
Sorry, I need to change it. It's very tricky because the national partnership is over 5 years, so the proportion of the funding over 4 years from the Commonwealth is 175 million.
Okay. And so
Yeah, I know, but it's 4 years in our budget.
Yep, got
Yeah,
it.
that's the tricky bit. Yep.
Right. So what's the additional amount that the New South Wales government puts on top of that then?
The New South Wales, we match it, so the 272 would be obviously well over what the Commonwealth.
Okay.
Yeah.
So that's all I see. So that's 272 million of additional funds to what the Commonwealth has put in over 4 years.
Correct.
Thank you. That's really useful. If you could provide either now or on notice how that amount has been allocated year on year between domestic and family violence initiatives and sexual violence initiatives and what they are, that would be really useful. I think we've got that information a couple of years back under the previous government. It would be useful to see sort of how that's changed.
So is that for the past 3 years, or are you looking at future as well?
I think since we last provided, I mean, if you could just look at it over the life of the agreement, so maybe that 5-year period, that would be useful if that makes sense from a financial perspective. That would be the way to
Yep. Happy to
do
take
it.
that on notice.
Thank you. Let's hop around now to. Oh, sorry, my time is out.
time's
Sorry.
expired.
Apologies.
Thank you. Minister, just continuing on domestic violence and sexual assault, are there currently initiatives to identify, prosecute and rehabilitate female domestic violence offenders in the same way as there are for male domestic violence offenders?
Yes, there are. And I
Can you
know.
elucidate on what those programs are?
Yeah, so well, certainly the strategy in relation to perpetration of violence, for people who use violence, will relate to anybody who uses violence, whether that is a man, a woman, an older person, a younger person, somebody in their middle age. So certainly that strategy relates to everybody and will include women. In relation to our laws that we've been bringing in, they are not gender specific. They relate to people who use violence. So, for example, the strengthening of our bail laws, the implementation or the introduction of serious domestic violence abuse protection orders. All of our legislative reform relates to anybody who uses domestic family violence. In relation to programs within our prisons, that question would be best asked of the Minister for Corrections, because he has the further detail in that. But
So you're saying that, in general terms, that the same programs that are available to control men, I suppose, are also available to control women in domestic violence as domestic violence offenders?
Well, we recognise that anybody can be a victim of domestic and family violence, and we also recognise that anybody can be a perpetrator of domestic violence. The fact is that the majority of people who are victims of domestic violence are women, and the majority of people who perpetrate violence against women are men. However, programs do relate to people who use violence.
Thank you. Minister, there's no secret that women in lesbian relationships are dramatically more likely to suffer intimate partner violence than people in any other relationship, 41% on the low side, and as high, by some estimates, as 61%. Can you detail some of the measures and strategies being employed to combat intimate partner violence in lesbian relationships, as a government who have a big heart for the LGBTI community?
I don't have the detail on that. It's something that we've been working with organisations.
Sorry, I didn't quite catch that. You said something you are working on, or your organisations?
Yeah, I don't have the detail on that right at the moment, but it is something that we've been working with and with some of the peak organisations in the LGBTQI space, and we certainly fund organisations like ACON to provide support to people who are their members and people who they represent, to assist them as
specifically for the
victims.
lesbian community?
for people who they represent. So it would be lesbian, bisexual, trans, intersex, queer, sexual.
I can add to that, Minister.
Yep, thank you.
So, as the Minister said, we're funding the Acquired Immune Deficiency Syndrome Council of New South Wales, ACON, to deliver a project under Response Matters seeking to improve responses to disclosure of sexual violence. That includes ACON's project to improve LGBTQI+ community responses to disclosure, survivor stories, sexual violence recovery and healing project, a project under the New South Wales Sexual Violence Project Fund centred on a consult service to improve LGBTQI+ inclusivity, you can't say that word, in sexual violence service provision, funding for a DFE, perpetrator programs targeting same-sex domestic and family violence, and funding for 5.8 new frontline workers in LGBTQI+ services. So that's ACON, the Gender Centre 2010, to bolster responses to LGBTQI+ people experiencing domestic and family violence.
Okay, thank you. Minister, I'd like to speak about the incidence of sexual assault on the rise at present. There are rigid and effective measures for male sexual offenders, but there has been an almost 208% rise in the past 2 decades in female sexual offenders. The University of the Sunshine Coast reports that while this may appear in the media to be teachers with schoolboys, most cases are mothers abusing their own children. There's also very little in the way of rehabilitation for female offenders. Could you, Minister, detail what is being done to reduce the incidence of women's offenders and what services exist to rehabilitate them?
So our approach to sexual violence is within our sexual violence strategy and the actions under that. I'm happy to probably take that on notice, though. That's a level of detail that I don't have in front of me at the moment, and I might be able to provide it in future.
Sorry, you said you're going to take it on notice?
I can take that on notice.
Okay, thank you. I'd like to now refer to gender equality budget statement. The government states that that the industry gender segregation in February this year saw 76.1% of healthcare workers and 69.4% of workers in education were female, and that 87.2% of workers in construction and 81% in mining were male. Will the New South Wales Government be funding more TAFE positions for women in bricklaying, building, plastering, plumbing and tiling trades to address the gender imbalance in the construction sector and address the desperate need for more housing?
Certainly, I have had the benefit of going out to one of our TAFEs to see the work that's being done by an organisation called Habitat for Humanity, and the work that they're doing in relation to increasing the number of women in the construction sector. They've got a really wonderful program where they particularly train up women who have been finding it difficult to get work, and giving them trades, getting them ready for trades. We also have our Women in Construction program, which is really focusing on increasing the number of women in trades in construction. Over the next couple of years, that program is really going to be focusing on attracting and retaining women in trades. And the priorities previously under that program have included the Industry Innovation Program, where grants have been provided to 34 initiatives under women in construction. There's been an action for communications engagement to actually increase the desire and awareness of women to focus in a career in construction, and to also increase the major infrastructure projects that we're involved in as government, and the number of women who are involved in trades in construction. So not just in the contracts that are provided, but actually really focusing on women being involved in trades in construction.
Is there a specific budget, a dollar budget amount allocated to that?
So the Women in Construction program, I don't have the overall budget in front of me, but I can tell you. So, for example, the Industry Innovation Program provided $5.9 million worth of grants.
Okay, thank you. I might pass over to you.
There you go. Thank you. I might just follow up on a couple of matters from this morning. I just want to confirm that you made the offer to Miss Webb for this advisory role?
Yes.
Yep. And on what date did you make that offer?
3rd of June.
3rd of June.
Yes, I'll just check. Yes, 3rd of June. I wrote to Ms. Webb.
Could you table the letter of employment?
Yeah, it's not actually a letter of employment because she already has employment. This is about the work that she would be doing within the portfolio of domestic and family violence.
Could you table that?
I don't have that particular. I'll need to take it on notice.
Yep. And did you discuss with the Minister for Police this position, and that the Minister for Police would be funding it?
No, because it was my understanding that that was the case from discussions with the Cabinet Secretary.
But it's not the Premier's budget, it's the Police Minister's budget, employing a person who reports to you, and you made the offer of employment. Did you not discuss that with the Minister for Police before offering a position?
Can I?
No, because my licence tippled.
In a strict sense, it's not an offer. It was not a letter of an offer of employment, and in terms of DCJ, and it effectively, in a sense, is unpaid work. The matter of Ms. Webb's employment entirely resides within the police portfolio and her employment relationship with that portfolio.
Although reporting to the Minister for Domestic and Family Violence, Prevention of Domestic and Family Violence.
On this piece of work, yes.
Just in relation to the workforce development strategy, which was announced this morning. Now, it's a 10-year strategy, and I understand in it there's a number of action areas. And just looking at those, one, understanding the workforce, the action items involve mapping, describing and categorising a range of jobs, collecting and analysing data. Number two is prioritising workplace safety. Again, that's about developing and implementing quality standards, developing a framework. Number three is expanding the workforce pool. Again, examining feasibility models, also developing a series of journey maps, and it goes on. It appears the 10-year strategy is really full of a number of action items where you will be examining, exploring or planning rather than actually doing.
Sorry, I'm not sure what the question is.
My question is, this strategy actually has no action items where you're actually doing anything to deliver more staff or keep the staff. And the fact that your press release says that you want to support the recruitment and retention of skilled workers, there's nothing in here. This entire strategy is about data gathering or exploring resources, developing and auditing. So you're actually not providing any tangible programs or initiatives or direct funding to retain or recruit staff, despite the fact that you said this is underpinned by significant research and evidence, and yet you're spending the next 10 years doing more research.
Well, this strategy is based on significant consultation and research with the domestic and family violence sector.
Then what exactly are you doing?
The New South Wales government doesn't directly employ workers, specialist workers in domestic and family violence, but what we do is obviously we provide funding to services. These are the items that the sector has told us that they want government to do
more
for them.
research and data gathering.
Well,
Wouldn't they prefer the 2.5 million for frontline staff?
They want us to develop quality standards for organisations delivering domestic and family violence services. They want us to create a culturally responsive clinical supervision guide. They want us to develop an industry workforce safety, health and wellbeing framework.
And why haven't those been done?
Well, I don't know. You could ask your previous government too.
But Minister, you've been there 2.5 years. You've produced another strategy, which is a 10-year strategy that's just doing more research, data gathering. You're not actually delivering anything specifically to support frontline staff. That money, the 2.5, probably could have gone directly to frontline staff rather than producing a document that talks purely about gathering more data and doing more research.
This is exactly what the sector has told us they need to recruit and retain people within their sector so that they can provide good services to victims, survivors.
Do you intend to
of domestic
produce
and family
another annual
violence.
report card on how you're tracking or how this will be measured?
We'll be reporting on the implementation of the actions within the workforce development strategy on a regular basis.
So another framework
We've
or
actually
another...
confirmed.
I'll hand over to my colleague.
Minister, 1 in 7 couples in Australia has fertility issues and 1 in 16 children is born via IVF. A single round of IVF, I'm sure you're aware, can cost up to anywhere from $6,000 to $12,000. How much has been allocated in this budget to improve access to IVF services?
I don't have that off the top of my head, and that would sit in the health. That would be in the health budget, which so it would be a question that would be better asked of the health minister to get the exact figure.
I'll just make the point that we've talked a little bit this morning about intersectionality, and we've talked about intersectionality of portfolios. Obviously, many portfolio areas overlap, cross into, intersect with other portfolios, including yours, but you don't seem to be able to provide us any detail around where your portfolio does intersect with these matters. Now, IVF services is something that's critically important to women and families. Are you suggesting that you don't have any detail about IVF services and whether funding is being allocated to this really critical area?
Chair, I'm just going to raise a point of order. There's a couple of times now that the opposition have just made a statement without asking a question.
That wasn't
in order to elicit an answer from the minister, it's probably best to have an actual question.
To the point of
Would you
order,
like
Chair,
to,
that was a question.
Would you like to repeat the question?
Well, it was about the
not sure
intersectionality of portfolios and your intersectionality with health in this instance as the Minister for Women around IVF services. Do you have any detail on budget allocations for IVF services given this critical sector to women? The question is...
That was more of a question.
The question is, do you have any detail in relation to budget allocations for this critical area?
As I said, the budget is held within health, but I might ask Ms Walker to provide some further detail. I believe she has some additional information.
Thanks, Minister. So even though we don't have the overall details of the total IVF health budget, we are aware that a pre-IVF fertility testing rebate of $250,
Yes.
which helps eligible New South Wales residents with the cost of fertility that you pointed out, can be very expensive, and also $2,000 through the fertility treatment rebate for eligible fertility treatments.
Great,
Thanks.
and I appreciate that. And Minister, I don't mean to harp on this. However, you have stated previously that your role as Minister for Women is to take a cross-government approach so that agencies across government, and your role is to lead the work of the women's strategy. So that is working across government. So I do believe that these questions are in order, even though they do overlap with other portfolios. So I might persist a little with this particular line of questioning as well. In relation to IVF services, and under our former New South Wales Coalition government, we funded $42 million over 4 years to improve access to IVF services with a non-means tested rebate for treatment, which Labor then implemented means testing. So why did your government scrap the non-means tested IVF rebate?
Well, there were a number of things that when this government came in that we needed to do in order to be financially responsible. I can't speak to the detail of that, but what I can say is that this government is working very hard to make sure that the decisions we make are decisions that are sustainable into the long term.
And you do acknowledge how important this issue is to women and families, IVF services and their access, affordability.
IVF, reproductive health is certainly an issue that is of concern to women families across New South Wales. Absolutely.
And we should be doing everything that we can to support and provide opportunities and accessibility to women and families when it comes to reproductive health and IVF services.
We should be doing everything we can to ensure the best reproductive health is available to women and people across New South Wales.
Are you aware, Minister, how many families women had accessed the non-means tested IVF rebate funded by our former government?
I'm not aware of figures in relation to the former government, no.
18,598. Do you have an idea of how many families, women, Labor's means-tested IVF rebate has so far supported?
I don't have that. As I said, this is an issue that sits more fully in the Minister for Health portfolio. So
in
he
fact,
may well have that
there's
level of
only been
detail.
276, Minister. What meetings have you had in your capacity as Minister for Women with fertility services to discuss these particular challenges facing women?
My meetings with external bodies are in accordance with what's on my ministerial diary disclosures.
So you don't recall any just off the top of your head, or whether
I don't
you've had
recall any off the top of my head, but
relation
meetings
to
that I've
fertility
had will be
services.
in my ministerial diary disclosure.
And again, coming back to intersectionality with portfolios and other ministers, have you had any meetings with either the Minister for Health or the Treasurer to advocate specifically for women's fertility support?
I have had meetings with the Minister for Health in relation to women's fertility support.
And you've advocated for that?
I have had meetings with the Minister for Health in relation to reproductive health for women, absolutely.
So are you able to elucidate whether that's in relation to additional funding, how you might provide additional support? Is there anything emerged from those meetings that is something a little more concrete?
The discussions that I've had in relation to, or with the Minister for Health, have been in relation to actions within the women's strategy, and in particular issues in relation to reproductive health across where there are gaps in New South Wales.
So at this stage, the only thing that is occurring is to continue with this means-tested IVF rebate. That's the only support, only idea for going forward.
Well, that would be a question for the Minister for Health.
Let's move to birthing services across New South Wales. Are you aware of the issues facing rural and regional pregnant women?
Certainly as a result of the issues in relation to
birthing services particularly. in rural and regional areas?
Yeah, that came up pretty clearly in the parliamentary inquiry into rural and regional health, yes.
Yep, so you are aware, and you're aware of the number of birthing services across New South Wales that have been closed?
I'm aware that there are challenges across New South Wales in relation to health, and that's an ongoing issue, and the Minister for Health is working very hard on ensuring that people right across New South Wales get the healthcare they need.
140 rural and regional birthing services across New South Wales have been closed. When you're talking about the Minister for Health again, but in your role as Minister for Women, how are you assisting to support and advocate addressing this issue for mothers, particularly in regional and rural areas?
Chair, I'm going to raise a point of order here. The member's asking questions about regional birthing facilities and cited a figure of 140 that have apparently been closed. It's my understanding that there have been no facilities closed under our term of government. Therefore, the question that she's asking is outside the portfolio of budget estimates in terms of the consolidated revenue for budget estimates.
To the point of order,
and I would ask
Chair.
you to rule it out of order because it doesn't relate to the Minister for Women's portfolio or the budget that she's prepared.
To the point of order,
presenting
Chair,
today.
the question I am asking is about the role that the Minister for Women is playing in addressing birthing services for women across rural and regional New South Wales. The number, if the number is incorrect, well, I'm sure that the Minister or someone will come back with an accurate. It's not about whether it was done in the last term of government. The question is, what role is the Minister taking in addressing birthing services for women in rural and regional New South Wales?
To the point of order, that wasn't the question that was asked. If the member wants to ask that question in particular, which
That was the
probably would
question.
be in
It is
order,
right here.
there was a lot of
It's posted
argument
cards.
in the question that was asked previously.
It's
So
right here, Chair. I'm happy to provide the question.
Well, there's no point of order because now the question's been reordered, so we'll...
Minister, in your role as Minister for Women, what role are you playing in addressing the issue around the closure of birthing services across rural and regional New South Wales? How are you advocating and supporting birthing services for women in these areas particularly?
Well, as has been said, I'm unsure about the figures that you've referred to in relation to closure of birthing services. That would certainly be something that would be a question for the Minister for Health. But what I'm doing is making sure that each part of government that has responsibility for action in the women's strategy is delivering on that action and reporting on those actions.
Can I ask which or any regional birthing advocates that you've met with that come to mind?
Sorry, you're asking
about birthing advocates, so such as the Bush Babies campaign. For example, have you met with any advocates around this particular issue?
That's in my ministerial diary disclosure. Yep.
Okay, but so you can't think of any just offhand?
Oh, I think one you mentioned, Bush Babies. Yes.
Very good. That when it comes to the parliamentary inquiry into birth trauma, I think that was the one that you were just referencing a few minutes ago.
I was referring to the inquiry into health in regional and rural New South Wales that predominantly occurred while the previous government was in.
Okay, so the parliamentary inquiry into birth trauma.
Right.
Did you have a role to play in that inquiry, and what might it have been?
Well, that was a parliamentary inquiry. Obviously, the committee played a key role in that, and the relevant Department of Health and Regional Health at the time provided.
But so you, as the Minister for
that.
Women, didn't provide or have any role to play in that regard?
No, because there was people with and organisations with expertise in the area, direct expertise in the area that were providing information to that inquiry.
So, have you or will you commit to ensuring that the government delivers on the 43 recommendations of this inquiry in terms of this really important issue for women?
Well, the recommendations of the inquiry obviously sit within the Minister for Health's responsibility.
But as you as Minister for Women, will you continue to or take up ensuring that that your government does deliver on it? It's a really important issue for women.
Women's health in New South Wales is important. It's important that women in New South Wales have choice in relation to their health, and it is important that women in New South Wales get the health services that they need. And that is what this government is committed to doing, and that is what the Minister for Health is certainly working very hard towards.
Okay, one final one for you,
and I'm
Minister.
sure that you can elucidate more on it.
And coming back to ensuring that it is within the term of this government, your Labor government made an election commitment to restore birthing services at Milton Hospital on day one of being elected. Now, women still need to travel at least an hour to Nowra or Marooma, and the number of babies being born in that district is increasing. After 2.5 years into this government, babies are still not being born at the Milton Hospital. What are you doing, again, to advocate for pregnant women in those regions to ensure services such as this, that are critical in regional areas, are being provided as promised by your Labor government?
Well, I'm aware that there is work being done within New South Wales Health to do that. This government is absolutely driven to providing the commitments, or delivering on the commitments that it gave, and will deliver on the commitments that it gave. And that is a commitment that is being led by the Minister for Health.
Any idea of when, Minister?
Well, look, you'd have to ask the Minister for Health. I believe that his budget estimates might be on today in another room.
Yeah.
Ms. Boyd.
Thank you, Chair. Minister, I understand that there was no new investment in the budget for the Pathways to Prevention strategy. Will the government be allocating any more funding for that strategy going forward?
So the announcement that we made in relation to Pathways to Prevention last year was $38 million over 4 years. So this budget didn't provide any commitment for additional beyond that $38 million, you're correct. But that $38 million is spread. Part of it was obviously the 24-25 budget, and given that it was only announced toward, sort of a third of the way in.
Yes.
The majority of that $38 million will be this year, next year and the following year.
The sector was saying that you needed $100 million over 4 years in order to adequately resource that the primary prevention initiatives. So I guess maybe it's glass half full, glass half empty, but they're looking at, this sort of 62 million underspend. They were hoping that we would see that rectified in this budget, but so from what you're saying, though, there's no intention to try and increase that over the next few years. It's going to be the 38 million, and that's that for that strategy.
So the $38 million will provide the delivery of the actions contained within the Pathways to Prevention strategy as it currently stands.
If we get to, so say in a couple of years' time we haven't been meeting the targets under that strategy, is the intention to look for more money at that point?
Oh, look, this government will certainly look at the outcomes that are being achieved. Prevention work is long-term prevention work, so changing people's attitudes takes time, but if there needs to be an expansion into the future, we'll look at that at the time, as we should do with everything that we do.
How much funding's been rolled out so far under the Primary Prevention Multi-Year Partnerships Grant Program?
So there was $5.2 million provided under the Multi-Year Partnership Grant Program, and if we haven't signed all the contract, well, we must be very close. I think we've signed contracts because we've made announcements in relation to
so it's all
the
now been
recipients for
allocated?
them. Yep.
Okay, thank you.
Yep, there are 11 providers that received funding under that $5.2 million. There are 145 expression of interest put in for that 5.2 million.
Okay, thank you. The Common Approach to Risk Assessment and Safety Framework, the CARAS, what sectors are going to be prioritised in the rollout of that? And just before, if you're throwing to someone on that, just I guess the associated question is, how will the 3.6 million of funding in the 25-26 budget for CARAS be used? So is there a priority? What will be the first project?
Yeah. I will need to refer that on to departmental officials, because we're still going through the detail of the CARAS and exactly what it's going to look like. So but they might be able to provide some more information.
Yes, so in this year's budget, 3.6 million has been allocated to test and refine. And this is part of a 1-year package, so it's for 1 year. And I've got Miss Quincy here, who's in the detail, which is what I think you're after. So Miss Quincy, could you come up?
Hi. So what the money will be spent on this year will be partly informed by the insight that come from Karen Webb's work. The intention is that would build on things that would set good groundwork going forward. So the consideration of where you might start prioritising that work, what foundational work you need in place, whether the documents and the framework that's been developed need to be enhanced or changed, that will all be influenced by those things.
Okay. Is there collaboration also with the specialist domestic and family violence sector?
Absolutely, yes.
Okay. And so DV New South Wales are involved in what that implementation looks like as well?
Yeah, we've had conversations with DV New South Wales, and they're a large supporter of this piece of work, and we will be leaning on their expertise as we go through and testing what we're thinking around implementation with them as we go through that process.
Okay. When will implementation begin?
So that will absolutely begin this year. I think we are waiting for the outcome and the recommendation or the insights from Karen Webb's work to really think about the order that we do that in. But we have resources in place and a dedicated team within Department of Community and Justice that's doing that thinking alongside, so that we're ready to get going as soon as we can.
Okay, thank you. Minister, how will the 3.1 million of funding for the DFE data strategy be used, and what is that strategy? What is that work?
Yeah, so the data strategy is really aimed at making sure that we understand not only the figures that are reported to police, but also really to fully understand in a really robust way the figures that services across New South Wales are experiencing, the reports that are coming to them, and to make sure that the funding that we are spending is actually going into the areas where it's needed.
So
it will also assist us in ensuring that future funding will be going.
So is it then about collecting data on outcomes? Is that the idea, or is it?
That's a large. Well, it's partly about outcomes, but it's also about really about inputs as well.
So consistency of data collection?
Yeah.
Okay, so I'm just looking at, I was trying to sort of base it in what I've seen in other recommendations, and I guess in Victoria, the Royal Commission there identified this lack of shared understanding of client outcomes and a lack of shared understanding to then know whether services are meeting the needs of clients and whether there are sufficient resources. So is it a similar piece of work then to that?
Yeah, I might pass to Ms Campbell, but very, very much so.
Okay.
And it's looking at unmet need and demand as well, and analysis of that, minimum data sets and info collection. So at the moment we do get information from some of the DCJ and health funded programs, but not all of them. There's also work that the Women's Safety Commissioner has been doing around outcomes monitoring and looking at what are the outcomes, not just the stats from police, because we know that a lot of people experiencing domestic and family violence don't ordinarily report to police. And so maybe Miss Tonkin can talk to that. I think that would be useful for you to...
Yeah, and I guess I'm just going to add a question in while I can as well, which is just presumably then it would be very useful to have compatibility across jurisdictions. Is part of this work looking at that to ensure that when we're looking at stats from one state, we can compare them against another?
Certainly at ministerial council level,
Yeah.
there is a ministerial council for women and women's safety ministers, and comparability of our systems, comparability of data is something that we are working towards and talking about in that particular council.
Yeah.
It's a national, from a national point of view, we want to better understand it too.
So, yeah, I don't know, Ms Tonkin, if you wanted to add in there, but yeah, I'm curious as to, so this seems like a worthy piece of work. I'm curious about the time scale for it and exactly what the work is looking like when we're talking about the use of that $3.1 million then.
Yeah, I can talk to just a subset of that, which is the outcomes monitoring and reporting framework, as opposed to the data strategy as a whole. So that outcomes monitoring and reporting framework is something that my office has finalised in partnership with Boxar and Faxiar and various other parts of government. So that's pretty well finished now. We've got, as part of that framework, there are a number of headline prevalence measures, and Boxar's actually released publicly 5 of those that they've already put up on their website. So going to the earlier discussion this morning about measuring domestic and family violence and how do we have a more accurate, more sophisticated measurement, this is really important, I think, because it's moving beyond just looking at the rate of DV assaults recorded by police, which is going up, and actually looking at 5 different types of prevalence measures that we've developed. So that'll be part of the outcomes framework, but it's also already on Boxar's website. So that's women and children murdered by domestic family violence, and police records of incidents of domestic violence related grievous bodily harm. So that's 2 measures that are reliant on police reports, but then 3 other measures that are not reliant on the police, which is really important. So domestic family violence related hospitalisations, which are actually quite stable. Women who self-report experiencing violence, which is also stable, and adults who self-report experiencing domestic and family violence, which is going down gradually. So taken together, it actually shows quite stable prevalence as opposed to the increase in DV assault. So that will all come out in the outcomes framework. And just to answer your question about jurisdictions, with the outcomes framework, there is also a national outcomes framework that's been developed. So in developing the New South Wales outcomes framework, we have looked closely at what was happening at the national level to make sure that it's consistent and make sure that it's aligned with the national plan as well and the pillars.
Okay.
And it's also a key aspect of the National Partnership Agreement as well about developing much more robust outcomes from the investment. So we're working, the work that my team will be doing with the Commonwealth will be looking at how we, under the data strategy, is really to try and align some of those things. And also the work with the AIHW as well in terms of its reporting mechanisms.
Thank you.
Thank you. Minister, on the 5th of August, you put a media release out, Get Ready for New South Wales Women's Week 2026. Excuse me. The awards are seeking nomination of women and girls excelling in the following categories: New South Wales Premier's Women of Excellence, New South Wales Community Hero, New South Wales Young Woman of the Year, New South Wales Aboriginal Woman of the Year, and New South Wales Regional Woman of the Year. Minister, given statements you made in the February budget estimates hearings, is it the position that a man who identifies as a woman, i.e. a trans woman, is eligible to enter and participate in the 2026 New South Wales Women of the Year Awards?
All women can be eligible to be nominated.
So you're saying trans women can be eligible to be nominated and awarded the New South Wales Woman of the Year, the Premier's Woman of the Year of Excellence, Community Hero?
All women are eligible to be nominated and be awarded those categories.
Well, is it not an absurd situation that a biological man who identifies as a woman could potentially be announced on the 5th of March 2026 awards event as the 2026 New South Wales Woman of the Year?
Well, as I said, to it's the view of this government that all women should be able to be nominated and to be awarded if they meet the standards that are needed to achieve these awards, that they be rewarded for that.
Is that actually
Or
fair to a
recognised for it,
biological woman that's competing in those arrangements? In that,
Sorry?
is that actually fair to a biological woman that is being assessed under those various criteria?
Well, there's a robust...
What really should be a very good, it looks like an excellent program.
Yep, well, there is a very robust process for assessing the winners of each of those categories. I think in the past we've had some amazing women recognised through the Women of the Year awards, and I think we'll continue to.
So are you saying that in the future we're going to have some amazing men as women getting those awards?
Minister, there's, if I can just add that last year we received, or for this year's Women of the Year award, received well over 500 nominations. To reach the level of finalists, the amount of support you need from your community or your workplace or where you volunteer is extraordinary. So it's a really stringent process. So it would be, that person would be considered by their community and the people that nominated them as a woman. So it's a very, it's a really competitive process. So somebody has to be an outstanding member of their community to reach the level of finalist.
I don't know that actually answers the question, but anyway, what if they are an outstanding member of their community?
If they
as a
live
trans
and are
woman
accepted as a woman by that community, they'll be eligible for that award.
So you don't think it's absurd that they would get that award?
Personally, no.
You don't think it's absurd for a man to get a woman's award?
It's a woman getting a woman's award. So
No, it's a man's biological male getting a woman's award.
That's your...
But it gets down to your definition of what
Correct.
is a woman in the end of the day. Minister...
And that's the government's view.
And the government view, I know that, unfortunately. Gender equity budget statement, getting back to that again, the government's also proud that 66.5% of New South Wales public service workers are women, and by raising their wages, they have decreased the gender wage gap. Minister, does this mean that only female public servants enjoyed a wage rise?
No. All public servants, as a result of this government's commitment to fairness, have had the wages cap abolished.
Yeah, but I understand that. As a politician, I'm now subjected to another cap, and I don't have a problem with that. But if not, then how can you say the gap has been narrowed if everyone has got the same?
Because the majority of people who work in the public service are female, so the gender pay gap has been narrowed.
So how is that calculated? I'm an old accountant and I don't really understand how those numbers work. Can someone elucidate on that for me to help me understand it?
The gender pay gap? There's different ways that's calculated. So, the OECD statistics are different to, say, the Women's Gender Equality Agency. So some will take into account a part-time role as a full-time equivalent. Some will take into bonuses and things like that. But it essentially is about how much men earn per year versus how much women earn per year.
And if they all get the same, you're saying the weighting of more females means you've reduced the gender pay gap. Is that what you're saying?
So there's three things that contribute to the gender pay gap. So one is discrimination, where employers will...
Well, clearly discrimination is not an issue in this one, because discrimination's the other way around. I mean, if there are 50-50 male and female, you've got 66.5% female in the public service. Mm-hmm. So, yeah, please continue.
So in terms of the pay gap, the reason it still exists is because women take on roles of caring and other unpaid work in the family and in their community. So they'll generally work less hours than men do, so therefore per year they earn less than men.
So even with a 33.5% discrepancy between the two, in other words, nearly twice as many women work in the public service than men.
Yes.
And you're saying there's still a gender pay gap?
Correct.
Well, could you take on notice to show me a calculation how that's worked out? I'd really like to see that.
Yeah, so, and it's also about the roles that women do in the public service, so there are...
No, with respect, I understand that, and roles in the public service obviously influence how much you get paid, but I'd just like to see how that's calculated, please, if you can do it. Can you take that on notice? Is that
We'll
possible?
certainly see what, see whether we can put together
Thank you.
a response to that.
According to 10.2 of the Gender Equality Budget Statement, over 70% of women experience gender bias or discrimination when seeking healthcare, including for sexual and reproductive health. As 76.1% of healthcare workers are female, is the inference that the 23.9% of male workers in the health sector are biased? And these numbers are coming out of the budget papers.
The gender budget statement isn't making any assumption in relation to that.
Sorry, say that again? I couldn't quite hear you.
There's no such assumption being made in that statement. That the gender bias is something that is recognised in the Gender Bias Survey Summary Report by the Department of Health and Aged Care. It's something that's reported in that report, and that's what is included in this gender budget statement.
Well, are female healthcare workers themselves biased against fellow women?
I can't make an assumption in relation to that. The statement in this, that particular statement in this gender equality budget statement is as a result of research that's done by the Department of Health and Aged Care.
So there aren't any other deeper issues creating that perception of bias?
There's been some certainly reporting in relation to gender bias recently. What I am really strong on saying is that when a woman comes into a health service, she deserves her complaint, her health issue to be taken seriously and fully investigated. That's what we need to do as a government, and that's what we're working towards doing.
Okay. Opposition?
Yes, thank you. Minister, in 2024-25, the seniors state budget was $9.7 million. Correct? That's correct?
Directly within this portfolio?
For seniors? Yeah.
Yeah, but that's this. Across government, obviously, there are a multitude of different portfolios that hold funding for seniors.
The figure for the portfolio that you hold for seniors,
I don't have the exact figure in front of me, but that
Mr.
sounds
Tidwell,
like
it was 9.7 million. Is that correct?
So this. Sorry, were you saying 25, 26?
No, 24, 25.
Oh, 24, 25. I don't have those figures. I do have this budget years.
Yeah, great. So, okay, so we'll just, I have Mr. Tidwell here saying the 9.7 million is to allow continuation of key seniors program, so you can check that for me. But yes, the seniors budget for 25-26 then, Minister.
10.1 million.
10.1 million. And did you put out a media release talking up the budget to seniors in New South Wales?
There were media releases put out so that people across New South Wales understood what this government was doing in relation to...
Did you put one out talking specifically about seniors and what they could look forward to?
I don't recall. There's been a number of media releases that I've put out in recent months, and I don't recall.
Okay. For a second year in a row, the Treasurer did not mention seniors in his budget speech. Last year, you said that measures to support seniors, and I quote, didn't make it into the Treasurer's budget statement. it's not very respectful to this important cohort of our community that they've not rated a mention again this year. How do you explain that to seniors?
Well, I think it's important that there's a variety of stakeholders right across New South Wales.
They're a pretty important stakeholder.
Absolutely, as a Minister for Seniors, I firmly believe that.
I'm very pleased to hear it.
I'm very pleased to be the Minister for Seniors. We are continuing to provide some of the key seniors programs that seniors have come to love, and also to further refine them, to make sure that the outcomes for seniors are being achieved and that they can live their best possible lives.
Well, let's talk about some of that then, Minister. In previous years, the budget submission from the Ageing and Disability Commission wasn't agreed to by the government. What funding did the Commission ask for in this year's budget? What did they ask for?
I don't recall the detail of that, but I do know that there has been an increase in the ADC's budget.
If I can assist, the new Commissioner, whose commencement date is very recent, I can't call the precise date, but he was not involved in the budget process for this year, but just going to and I gave evidence on this 2 days ago, Mr. Overall, so I'm running off memory, but the budget, as I recall it, this year in totality for the office is $7.2 million, and it, as you may recall from previous evidence, there was a gap of about up to $2 million which had been funded with a lack of certainty from DCJ. What happened in the budget this year is the 5.72 budget was uplifted for four years by $2 million to 7.2. So that's $8 million over the forwards.
Over 4 years.
With $1 million coming from Treasury, but for 4 years.
Yep.
And $1 million also forthcoming from DCJ, but locked in for the 4 year period, which gives you the 2 year increase times 4.
Right. Times.
And if I may add, with the Mr. Smith's commencement as Commissioner, there of course will be dialogue about the priorities of the Commission and his particular identified priorities as Commissioner going forward as we contemplate further budget processes.
Okay, so Mr. Tidball, you may be able to confirm or perhaps take on notice, and it's just correct me, you may have just said there that that there wasn't a request for a funding amount specified by the Commission?
I would not mean to say that.
Right, it wasn't involved in the budget process.
Correct. I was specific to the new Commissioner. There is always, and we encourage it, we encourage right through our consultation and the budget preparation process.
For them to...
There is always encouragement to identify priorities. It's or potential initiatives. It goes without saying that various areas are very enthusiastic about what they propose.
Of course.
It's rare that everybody gets what everybody wants.
Inevitably.
In fact, that never happens.
But are you able to provide what may have been requested?
I'm not able to. So I'm not able to breach or disclose the budget process.
That's fine.
No.
Okay, thank you.
Thanks.
Let's quickly just move on to Minister. What the percentage of elderly people in Australia currently experiencing abuse, according to a new report released by Relationships Australia New South Wales, this has increased. Are you aware of the report and the increase in elder abuse?
I am aware of the report, and I am aware of the increase in reports in relation to elder abuse, and that's certainly reflected in the calls that are made to the Elder and Disability Abuse Helpline.
Okay, so they're suggesting that 15%, is that correct, are currently experiencing abuse as reported?
I don't have that Relationship Australia report in front of me, but if
Okay, and my understanding is that from 2023 to 2024, there's been an increase on the previous year of reports to the Ageing and Disability Commission as well. So numbers are and reporting numbers are increasing.
Yep.
So has any analysis been done on why and strategies to deal with it?
Yeah. The Ageing Disability Commission, and Mr. Smith is here, reports on the type of calls they get, the type of reports they get, and the investigations, if any, that they do, how those reports are dealt with, whether they're actually dealt with as mediation between families, whether they're dealt with through police reports, whether they're dealt with through an investigation by the Ageing Disability Commission. The Ageing Disability Commission has also been doing some work on the issue of neglect in ageing, in elder abuse, and which is an increasing form of abuse, and that's work that is ongoing.
Right, so analysis is happening, and what about strategies to deal with this? If we're seeing year-on-year increases, what's happening to address it?
Yeah, certainly the elder abuse collaboratives that are in place across New South Wales, of which I think at the last figure there was 14 of them, are locally based collaboratives of services and organisations and councils coming together to look at what is being experienced in those communities. Police are part of those collaboratives too, and what can be done locally to better support older people keeping safe in their communities and protecting them from elder abuse.
Okay, so from the sounds of that, Minister, you would agree that more needs to be done in this space as well?
More needs to be done in certainly in relation to elder abuse, there is no doubt. More needs to be done in abuse of so many different cohorts across New South Wales.
Okay. Look, just one very quick one before I hand back to my colleague. The washing machine exchange program. Can you tell us quickly about that?
So that is a program that is run through, I believe, the water portfolio, and it offers discounts to people on a pension who are wanting to upgrade washing machines.
Okay, and so, yes, to people on a pension, program announced on the 2nd of July 2025, within 3 weeks, July 23, Premier posted on Facebook the allocation of 8,000 washing machines had been exhausted. Because it was for pensioners, was there criteria that had to be met in order for them to be provided with these washing machines? And sorry, I think it's for $250. Yes, so front loader washing machine for $250. There was criteria around all of that?
There would have been criteria around that. The detail and the operational nature of that, I'm not across. It's something that sits in, I believe, the water portfolio.
Okay, so you didn't have any oversight in relation to pensioners being involved in that scheme? All through water. So
well,
it was all administered by them.
The operations of that grant were run out of, my understanding is, the water portfolio.
Okay. Given the 8,000 available machines were allocated in just 3 weeks, and you just said that the program is, so is it ongoing? Those 8,000 machines have obviously already been exhausted. Is the program ongoing? Is it going to be a continuing thing given its popularity? Will there be another allocation?
At the moment, I'm not sure where that sits.
Through water.
Yep.
And then the final point I'd make, that there's also been some talk of a glut of such machines available for sale on media trading posts. So I trust this is just a coincidence that they're not getting them and putting them up for sale?
I don't know about that.
Okay, so
Again,
no
that would be
oversight in
the operations
going to pensioners.
The
Okay.
operations of that grant program runs out of the water portfolio.
Okay.
Thank you very much. Minister, previously we've been advised that you'll be establishing the Domestic and Family Violence Lived Experience Advisory Group, and that would be done in the first half of the year. Has that been established?
It has been.
And how many people are on that?
I will refer to, 17. Ms Tonkin just confirmed 17.
And how often, do you chair those meetings or?
No, I don't. There has been one meeting of that group so far. I attended that. It's really humbling to be in a room full of people who are willing to give their lived experience and to help government learn from what has been a terrible experience for them. And I really look forward to hearing more from that lived experience group.
Fantastic. And I think later this afternoon I might talk a little bit more about their role in some of the policy and work that's done. Minister, has the Primary Prevention Network been established?
The Primary Prevention Advisory Group has been established, yes. I was very keen after launching the Primary Prevention Strategy last year that we move forward really quickly on that, so I established an interim advisory group. But having said that, that interim advisory group is no longer meeting. We now have a permanent advisory group and they have met as well.
And who's on that group?
There's a number of people on that advisory group. The membership
I've been
list.
taken on notice. It's easier.
Well, we can get back to you later today about that.
It's a large group, yeah.
And that's
we
the
met
one
for the
that-
first time yesterday.
Yeah, the first meeting was yesterday. It is an extent. It is a considerably. It's a really diverse group. It's
And
really
that's the
heartening
one
to see so many people leaning into wanting to be part of stopping violence.
And that's the one that involves local government and Domestic Violence New South Wales?
So local government New South Wales is certainly a member of that. There is a member on that advisory group who works for a local council in addition. There's a wide range of people in that group. And yes, Domestic Violence New South Wales is on that too.
Perfect. In relation to the New South Wales Aboriginal Domestic Family and Sexual Violence Plan, when will that be completed?
The plan is to have that released by the end of the year.
Okay. And what role does Aboriginal Affairs, Department of Aboriginal Affairs, have in the development of the plan?
Aboriginal Affairs is certainly consulted in the plan, but the plan is being led by Transforming Aboriginal Outcomes within DCJ in conjunction with the Aboriginal Legal Service.
Okay. The Domestic and Family Violence Outcomes Framework, when will that be released?
I might ask Ms Tonkin where we're up to with that, because Ms Tonkin is overseeing that framework.
Yeah, it's been finalised. It's just going through the final approvals process at the moment.
And do you have a date for release?
Oh, not a specific date, but it will be soon. It'll be in the coming months.
Coming months, yeah. Okay. And the report card, and I understand there was one for the 23-24 was released. When's the 24-25 due?
But that will be released towards the end of this year.
End of this year, okay. And the People Using Violence strategy, that was due to be released mid this year. When will that be released?
Yeah, again, I think that will be before the end of the year.
And why has it been delayed?
Because we have wanted to get having a strategy that doesn't quite get things right will be dangerous. So we want to make sure that it gets things right. And so we've really wanted to make sure the consultation we're doing on the final draft is right, and that's where we're at the moment.
And will it have outcomes that are measurable, unlike the workforce development one, which doesn't have any outcomes listed or anything that will be measured?
I think there'll
Ms.
be,
Campbell.
I mean, it's also, there has been extensive consultation on this, and there's varying views across various sectors on this particular strategy. So I haven't yet seen the draft, but I'm happy to provide that on notice.
Well, Minister, will you give a commitment that the strategy will actually have outcomes and something that's measurable and deliverable?
Oh, look, I am really keen to make sure that the work that we do right across this portfolio area makes real difference to the safety of, in particular, women and children, anybody who is experiencing, in fact, so men included, anybody who's experiencing domestic and family violence. That is why we're doing the work like the outcomes framework. That is why we're being, that is why we're releasing report cards on what we're doing and what's being achieved. We'll be absolutely making sure that the work that is done as part of the People Who Use Violence strategy is really aimed at achieving real outcomes on changing people's behaviours.
In relation to the perpetrator strategy, we're being advised to be available by the end of the year. Is that still on track?
That was the answer that I just gave. That's the People Who Use Violence strategy. Yep.
Right, okay, so it's not two separate strategies, only because in the previously it's been used interchangeably.
Yeah, so I'll just explain that if you like.
Yeah.
Why? There is conjecture on whether we should be using the word perpetrator or whether we should be using the term someone who uses violence. There is certainly, we want to make sure that people who use violence, the perpetrators of violence, are held to account. The word perpetrator and a person who uses violence will sometimes be used interchangeably, but we also want to recognise that some people who use violence aren't the typical, person who needs to be locked up because they're a terrible person. One of the sessions that I went to in consultation on this strategy was aimed at older people and dealing with issues of older people who use violence. Somebody who has dementia who uses family violence, it's very difficult to actually call them a perpetrator of violence. Somebody who's a child who uses violence, because they've experienced trauma, it's very difficult to label them a perpetrator too. So that's why there has been this need to ensure the language is right. As Ms Campbell said, it does draw varying views, but we are really wanting to make sure that we walk that balance of recognising that there are different reasons for people using violence. We want to get our laws right, and we also want to make sure that we support, that we provide programs for people who use violence in the areas that need to be provided.
Thank you for that explanation, which is very good. And just my final question, just in relation to the support that's provided to the, particularly to caseworkers, people who work on the front line, in engaging and working with children and young people who have experienced violence. What work's been done?
So we have specialist workers for children, young people who are based in domestic family violence services.
But that's not across every service?
No. We've expanded the number of specialist children's workers.
How many do you have now?
Do we have the numbers?
Yeah,
for specialist children's workers here? I know it expanded considerably.
Extension, all existing 21 of these service contracts supporting over 22 refugees have been extended from 1 July to 1 July 24 to 30 June 26. An additional 10 services have been allocated funding to 30th of June, bringing the total number of services funded to 31, supporting over 32 refugees and employing over 55 workers across 80 LGAs.
Thank you.
Just on the back of those questions then, I guess there's been a lot of work done by the sector to focus on children and young people as victims in their own right. I understand, though, that when it comes to the calculation of service funding, it's not calculated on all people who access the service, but it's on. So if you to a woman's refuge, you would count the woman, but you wouldn't count their children as people who are accessing the service for the purposes of funding. Has there been any moves to correct that?
Can I take that on notice and come back hopefully this afternoon?
That would be great. Thank you. Minister, have you read DV New South Wales's Breaking Barriers report and the 8 recommendations in there?
I haven't read the entire report, but I am familiar with the recommendations.
Will the government commit to adopting any of those recommendations?
We're seriously looking at them, having conversations with Domestic Violence New South Wales about what that might look like and the priorities in there. The issues that they raise in that report are valid issues.
One of those issues is that women on temporary visas experiencing domestic and family violence are not guaranteed access to New South Wales crisis accommodation due to a lack of funding by New South Wales government, and that places pretty immense pressure on frontline services. They're having to decide whether to turn a person away because the funding won't be provided, or whether to sort of bring that person in on a temporary visa. Is that something that you've been looking at, in particular speaking with the Housing Minister about expanding that eligibility for crisis accommodation?
Yeah, I mean, that's certainly an issue that that's dealt with. That's a problem right across the country. It's a challenge between, obviously, jurisdictions, and we want to make sure that what we do is that we work with, in particular, the federal government to provide better services for women on temporary visas. In particular in New South Wales, though, I can say that women on temporary visas can access all New South Wales domestic and family violence services. So they can access specialist homelessness services. They can access core and cluster refuges. They can access our Safer Pathway process. They can access Staying Home Leaving Violence program, and they can access the free legal assistance and interpreter services.
Okay, but they can't access the broader sort of New South Wales housing and homelessness system in the same way. So I guess then what happens, even if they've got that crisis accommodation, if they then want to go on to have temporary accommodation or social and affordable housing, what happens then? Because they're not eligible under the broader housing.
Yeah, so obviously, I mean, that's a question in relation to housing.
Is that something you have been advocating though? Because that puts extra pressure on the crisis accommodation if people are happy to come into crisis accommodation instead of being able to use other homelessness.
Yeah, it's something that my office, it's a challenge for government, and it's something that we're grappling with.
Thank you.
Minister, just to come back to a previous topic of men and domestic violence support, both as victims, survivors, and those wanting to seek assistance in preventing domestic violence from a personal perspective, what sort of funding is being allocated to these programs?
So are you after a dollar figure on?
Or even if if you need to take that on notice, even if you're able to, are you aware, has there been increased funding for such programs?
Yeah.
There has?
So on top of the local support services that I talked about previously and identified all of the services across New South Wales, which covers all of New South Wales, there's also been we also provide men's behaviour change programs. They have to comply with certainly some strict criteria about the way they are provided, because we want to make sure that anybody who goes through a men's behaviour change program receives the right kind of information and support. Obviously it could be dangerous if that's not provided. So the number of men's behaviour change programs across New South Wales have been expanded. They were expanded under our emergency package last year. There are still areas of New South Wales where there is no coverage of men's behaviour change programs. That's something that we'll look at in future. It's certainly something that I think there's a lot of men's behaviour change programs is a fairly new area in this space, and it's important that we get it right. I want to make sure that the evidence is there, that what we're doing in relation to men's behaviour change programs is providing the right outcomes. And along with that, we'll be looking at how we might be able to expand programs like men's behaviour
Okay, great.
change programs.
So you can take on notice then to furnish some figures around what that increased funding is for those programs?
I can certainly provide to you information on where those programs have expanded in recent times.
That would be great. Thank you.
I can tell you now where we've got men's behaviour change programs.
You mentioned where they were.
Okay, so we have.
So where have they expanded?
Anglicare is now in. Anglicare is the provider of men's behaviour change programs now in Nowra and Ulladulla. They previously were the provider in Parramatta and continue to be. Lithgow has recently become covered by men's behaviour change program provided by Plus Community. Foster and Gloucester have recently received men's behaviour change programs provided by Manning Support Services. Blacktown and Maitland have recently received men's behaviour change programs provided by Relationships Australia and New South Wales. And Central and Far West receive outreach programs provided by Mission Australia Central and Far West, and that doesn't include where they were previously in existence.
These are in addition to.
Yep.
Okay. And yes, perhaps just on notice about funding that might be attached to that, what the increase has been.
I can certainly give you information easily about the increase in men's behaviour change programs.
I've actually got that here. So from 2020-21, it was about 10 million. In 2024-25, 13.1. So it's been going up. Obviously, the emergency package extended that quite substantially. The other thing to note is the men's behaviour change program is under evaluation, so we'll have an evaluation report next year. So that will build, as the Minister alluded to, a much stronger evidence base about what works and doesn't work in this area.
Okay. Thank you.
Okay, we've come to the end of the questioning. Thank you very much for your attendance today, Minister.
Thank you.
I beg your pardon. I'm always jumping over you, sorry.
It's all right, the Minister's answers were
Wishful
so
thinking.
fulsome, you're forgiven for
I beg your
not
pardon.
thinking there was anything more.
No more questions?
No government action.
Thank you.
Okay.
Thank you for your interest in these
Thank you for your
areas.
attendance, Minister. I note the number of questions we've taken on notice. The Secretary will be in touch soon. Thank you.
Thank you.
And now we'll
Thank you, Chair. I wanted to pick up on where I was in the last set of questions in relation to migrant and refugee women. So my understanding is that the government provides no funding for refugees to support women and children on temporary visas. So although they can access them, the services can't afford to actually service them because they're faced with having to either turn them away or spend a lot of their own money. And so DV New South Wales' research found that 38 women's refugees spent approximately $320,000 collectively over a 3-month period alone in 2024. Each service spent approximately $20,000 on average, and the average cost to support each family was $4,800 in that 3-month period. So that includes things like living allowances, medical costs, food, clothing, transport, and vouchers. So one of the recommendations from DV New South Wales was a pilot of $3.45 million in funding for a 2-year pilot across all frontline funded domestic and family violence services to allow women on temporary visas access to this essential support. So that, I hope that clarifies my previous question.
Yep.
Has the government done any work looking into that funding gap?
I'd need to take that one on notice. I know we've looked at it in the past, but certainly it may be linked to, the current asks of a range of services and priorities. So I'll take that on notice, Ms. Boyd.
Thank you. In a similar vein, I understand that most women on temporary visas are ineligible for the federal social support system, including access to Centrelink and Medicare, as well as the New South Wales Housing and Homelessness Services. Is this something that has come up in sort of cross-jurisdictional roundtables? Is it a live issue in discussions with the feds?
In terms of the homelessness services, they are eligible. It's just the social housing aspects, and I need to take on notice temporary accommodation. In terms of your other question, it depends on the type of visa. I don't think there's a range of different visas where they are eligible for certain things from the Commonwealth Government, but then some other visa types aren't. But there was work done a couple of years ago on that. Nothing recently though, but again, I'm happy to take that on notice.
Thank you. The Victorian Government provides funding for brokerage specifically for migrant women on temporary visas, and there's already been reports that that's having quite a good impact. Is that something the New South Wales Government has considered? Has there been any discussions on that so far at a departmental level?
Not
Not
recently.
to our knowledge.
Okay. Could you take it on notice to see
Yes,
if there's
happy
been
to do that, Ms.
anything? Thank you. Similarly, I know that there were recommendations that the government consider funding culturally responsive support for migrant and refugee women, and there's been a number of other really good recommendations in that report. Is there a time limit or a time expectation rather for when the government might respond to the issues that were raised in that report? Is it a stream of work that the department has been tasked with doing, for example?
Again, need to take that on notice, but there have been some initiatives that have already rolled out in response to some of the issues flagged. So there was the election commitment in terms of the multicultural centres that has funded it over the forward estimates, I think for 3 years, and obviously there'll be an evaluation, but I'm happy to take that on notice because there's been quite a few initiatives where we've really focused on culturally and linguistically diverse communities, and particularly in some of the, obviously in southwest Sydney, I know there's a number of services, but equally some services out in regional areas. And I know the Multicultural Service Centre, and I forget what it's called. Can you remember what? Anyway, it's, I think, run by the Muslim Women's Association. We're looking at expanding their support out of Sydney as well, and looking at some communities of practice.
Thank you. Just turning now to women with disability in the domestic family violence context. The National Plan to End Violence Against Women and Children, 2022 to 2032, my understanding is it anticipates there being an action plan for women and children with disability to accompany that. Has there been any work done on that plan so far?
Yes, what they're looking at is not changing the plan but identifying 10 specific areas in the existing plan. And I understand that I think the draft's due towards the end of this year.
Mm-hmm.
Yes, and I think we're consulting at the moment or working with the Commonwealth on that.
Okay. Last estimates in February, we were told that there were 7.6 new frontline workers to specifically respond to women with disability experiencing domestic and family violence. Is that part of the funding that's come through from the Commonwealth for new frontline workers?
Yeah, the 148.4 or 4.
Yep. And is there an update in the number of frontline workers since February, or is it still 7.6?
It's the 7.6 in total came out of that package.
I see.
For women with disability.
Okay. Thank you. How much funding is currently allocated to the hearing support pilot for WDV CASs across all 27 of them to 2028? I think I've got that here.
$. So the total contract value is $54,271,803 in 24-25. And through the last budget, we also got the hearing support in the co-located services extended. So for another 2 years.
Okay. So, sorry, to 2030 then? Is that, or is that to 2028?
It'd be 28.
Yes, so the 2 years funding, the additional 2 years funding was for 25, 26 and 26, 27 for both of those programs.
Right. Okay. Thank you. And will we? So the evaluation for the pilot showed that it was doing really well, as we would expect. Has there been discussions about expanding it then beyond the 27 services currently using it?
There's been lots of discussions. It depends on the fiscal environment, but certainly it is a service that we, as you've said, has been evaluated well and is making a difference out there. So we'll consider to look at how we bring together an ask of government going forward.
Thank you. Has the, I'm just turning now to the WDV CAS and New South Wales Police Force co-location pilot, which we're also big fans of. Has the University of Wollongong evaluation of that co-location pilot been completed?
It's expected in the third quarter, so soon.
Okay, third quarter. Good. And is DCJ involved in that evaluation, or is it purely being done by the University of Wollongong?
It's the University of Wollongong and Legal Aid directly. DCJ are interested in it because the WDV CAS is a part of the Safer Pathway program that we steward the whole program. So we're interested, but it's led by University of Wollongong with Legal Aid.
Okay, thank you. In relation to the $48.1 million over 4 years that was allocated to expanding the specialist, for the Specialist Workers for Children and Young People program, are you able to provide a detailed breakdown of where that $48.1 million over 4 years is allocated?
I think I can. So for 24-25 it was 11.5 million. For 25-26, 11.8 million. For 26-27, 12.2 million, and for 27-28, 12.6 million. So all existing contracts supporting 22 refuges have been extended from 1 July 2024 to 30 June 2026. and then 10 additional services on top of those have been identified and funding allocated to the 30th of June 2026.
So does that mean that there's additional funding on top of the 48.1?
No,
for those
included.
included.
Yeah, but built on the previous investment through the emergency package.
Thank you, Mr. Chair. Can I just, I've got a few questions to Mr. Jeff Smith as the New South Wales Ageing and Disability Commissioner. I wanted to ask you, Commissioner, if you'd have been briefed at all in respect to the announcement from Federal Minister Mark Butler's announcement yesterday in relation to major reform to NDIS.
The short answer to that is no.
No, and do you expect to be? Are you? I mean, it's a bit of a worry. Do you expect to have some sort of briefing in the coming weeks? I understand that health officials did get a briefing at 4 o'clock. The Minister for Health advised me that earlier this morning that they did receive some briefing. Do you expect to have any briefing in relation to this, or will you be seeking out a briefing perhaps?
Well, the Ageing and Disability Commission is a small agency.
Yes.
We have 35 people within the agency. Well, I'm not expecting to get an external briefing about it, but I'll be looking into that announcement, and I'm familiar with the broad terms of that of what the Health Minister said. But
do you? What are your thoughts? So, as I understand it, is going to defer people with mild, or children with mild and moderate autism off the NDIS scheme, off the disability insurance scheme, into something called Thriving Kids. So have you had a briefing on what the Thriving Kids is? Has there been any discussion about that at all? Do you have any idea of what that could mean for New South Wales? As I understand it, they're going to start with a $2 billion rollout federally, but they're then expecting the states to contribute.
Sure, which is always anticipated under the terms of the NDIS review.
Yes.
From the point of view of the Ageing and Disability Commission, our remit does not include children with disability.
Oh, okay.
We only do with adults with disability and older people over 65 years, or for First Nations people over 50 years. So it's not surprising in that respect that I haven't received a briefing.
Okay, well, that's fair. Do you think, I'm just thinking of any of the other changes. He also proposed a lot of changes to the providers. You might have recalled yesterday, I think he made the comment that 15 out of 16 providers were not registered, or there were registration issues to do with some of the providers. So they, I think, as I understood it, they also want to tackle some of the fraud issues that have become quite prevalent around this scheme in recent years. Is that something that your office also might look into at any stage in its remit?
It's not really germane to the work that we do as
what
such.
Does predominantly your work in the disability space for New South Wales, what does the Commissioner do specifically?
So the space that we occupy is, so we have at a federal level, we have a number of commissions, if you like. We have the NGS Quality and Safeguards Commission, we have the Aged Care Quality and Safeguards Commission, we have the Healthcare Commission. All those commissions deal with abuse, neglect and exploitation of those respective, in those respective spaces where that abuse, neglect and exploitation takes place in regard to staff within those settings. So the Ageing and Disability Commission was set up to deal with the gap where the abuse, neglect and exploitation of people with disability, adults with disability or older people, was being committed essentially from family and friends. So you see that...
Not within the not-for-profit sector or within through the provision of any of these providers that provide services? It doesn't look into that area.
We have a different relationship with providers, but that is the mandate that we've had to fill that gap where, because we have those official commissions for where staff in those settings,
yes,
whether it's healthcare, the aged care sector or in disability providers are committing the abuse, neglect and exploitation. We were set up to fill the gap at a state level. Those other commissions are a federal level, where the abuse essentially is being perpetrated by family or friends.
Right, not as such whether it's a staff member of a particular provider.
Correct.
No.
And we do, of course, get calls through our helpline where people are concerned about abuse, neglect. You think about these issues from the point of view of the consumer, and people are, we're a relatively new agency, so people are only just finding out about us. And they will call us up and we will identify that that is a matter which we should refer, for example, in the scenario that you've posited, to the NDIS Quality and Safeguards Commission.
Okay, and do you keep a bit of data on how much you refer each year to that commission?
Yes, we do have data around the calls that we have, both the quantum of them and how they break down, yes.
Okay, and that's made publicly? Sorry.
It's on our website at the moment. So.
And do you then follow up, if calls are made to that commission in regards to the NDIS, if it falls into their remit, do you then follow up what the outcome potentially could be or not?
I'd have to double check on that. We have a series of MOUs with a range of agencies and...
Sorry, it's just with this line of questioning relating to the NDIS, I'm just curious as to how this relates to the seniors portfolio. Because it seems to be going down the line of questions around the disability portfolios.
Well, he's the commissioner for both, so it's impossible for me not to
he's appearing today in the capacity of the budget estimate schedule for women, seniors, prevention of domestic violence and sexual assault. Mr Smith very ably appeared on Tuesday with Minister Washington, so perhaps the questions would have been better put then or on notice via that portfolio, because they relate to disability.
Mr Chair, I don't think they're unreasonable questions of what the Commissioner's role is for New South Wales. He clearly is an ageing disability commissioner. I do have questions related to seniors as well, and I'm going to get to that. And I think I'm trying to understand...
This questioning line lead to that, will it?
Yes.
Okay.
So I don't think, in any event, I have to say, I think you're doing an excellent job of answering my questions. So
I agree.
don't think,
it's more just for
I think it's not.
process.
It doesn't require a point of order at all. All right. Well, you've got plenty of time to ask your own questions. Can I just coming back to whether there's no follow up in that respects? What is the relationship then? So I understand. Your direct calls to that particular commissioner. Is that the same with any complaints that you might have within the aged care system? Because I assume that you don't take specific complaints about aged care either. That would be redirected to the federal body as well.
Correct. Yes. So where those calls come in, if they come in through our helpline, then they are appropriately directed to whichever agency, federal or state, is best equipped to deal with it. So the space that we occupy is where the abuse, neglect or exploitation in relation to accusations regarding essentially family and friends.
Family and friends. And does that mean, of the 35 staff, do you have a bit of a breakdown of how many are working within the sort of investigations arm? I assume you do some investigations, or is it purely policy? What's the sort of your staff? What are they?
Yes, I can get you. I don't have those exact
figures. If you can take it on notice, it's fine. Yes.
Yeah. Well, not surprisingly, we have. If I can just put it here somewhere. The number of calls that we have is over 15,000 calls per year. So not surprisingly, our focus is very much on those frontline services rather than policy, for example. We have under our statute the function of safeguarding and protecting people from adults with disability and older people in New South Wales from abuse, neglect and exploitation, in doing work to raise awareness about what abuse, neglect and exploitation looks like and what you can do about it, and also doing inquiries to the government about systemic issues that do arise. So our statutory framework envisages those three functions, but at the moment, and given our size, most of our resources are put into those frontline services around doing the helpline, community supports and investigations.
And that involves working with the police then, is that right? Directly with the police?
Yes,
in
we
some of
work
those
with the
instances?
police. We refer to the police, but we also work with the police on particular matters.
Okay, thank you.
Thank you. Thank you very much. I might actually just go back to some questions and to get some clarification in relation to Miss Webb's employment. So I understand that she resigned or announced her resignation on the 7th of May to take effect the 30th of September.
I do not have the May date. It was definitely in May. The resignation was to take effect May 30, and her ceasing duties in her role on the 7th of May to enable a transition of leadership, as I understand it.
And then you were contacted in May by her or by the Premier's office?
No, by neither, by the Cabinet Office.
By the Cabinet Office. And their approach was to identify work for her in relation to domestic and family violence.
It was not put, as I recall it, Ms McLaren-Jones, in those terms. It was that there was an opportunity to do some work in the domestic and family sexual violence space and to open discussions about that.
And then those discussions continued over a month to when she then signed, she was presented with a letter signed by the Minister Harrison on the 3rd of June.
I also, less than a month, as I recall it, and as I understand it, Ms Webb had raised the possibility of doing some work in this area. Okay. And it was as a result of that that the discussions between the Cabinet Office, DCJ and the Minister ensued.
Is it usual practice that if someone is to announce their retirement or pending retirement 3 months later to then be given a different special advisory role?
I do not know, and my involvement in this was in no way about the employment arrangements of Ms Webb. It was specific to the identification and development of this piece of work.
And the Minister took on notice this morning to provide a copy of the letter. By any chance, do you have that available now? That's outlining, I understand, the job description.
I have a letter which I wrote on the 3rd of June to the Minister with some notes I've written on it, but I have a letter I wrote to the Minister about the role which followed and in essence confirmed the discussions we'd had about the common approach to risk assessment and safety framework piece of work.
And are you able to table that letter?
As I said, I've actually taken some notes on this. Okay. It's not just a clean copy of that letter. I would be very happy to table that letter when I can, or to provide it to the committee.
Yeah, that's fine. And so the Minister didn't actually then write to Ms Webb. It was the correspondence that went from you to.
She did. She subsequently did. I do not have a copy of that letter. I can take on notice whether that letter can be provided, but I imagine it could be.
Yeah. Okay. Thank you. Just to clarify, and then
and just on that, if I may, that correspondence very much though is focused around this piece of work. So there was nothing happening within my responsibilities in terms of that the employment-related issues that was happening elsewhere. It's not does not fall within my remit.
And that would fall under the Cabinet Secretary area, or is it? So the actual employment. The reason I refer to it is that the Public Service Executive 2025 Annual Determination, which states the item number 38, 39 and 40 refers to Ms Webb's announcement of her resignation, which was in May. But then in the interim, and I'm quoting here, in the interim, Ms Webb has been seconded to a special role advising the New South Wales Government on domestic violence, that being the Special Advisor on Domestic Violence. Ms Webb still has an effective retirement date of the 30th of September. And then goes on to say that although that role would normally not be expected to attract a salary equivalent to the Commissioner of Police, the Tribunal believes that it is appropriate for Ms Webb to maintain her existing salary without an increase until the formal retirement on the 30th of September. So you were not involved in her employment as salary?
No, not at all.
Which department was?
I would need to take that on notice. Possibly the Premier's department, but I would want to be very precise in my response. I'd prefer to take that on notice and advise the committee if I may.
Yep, that's fine. In relation to the work that she's been assigned to do, for the benefit of Hansard, the common approach to risk assessment and safety, Karas, is that the primary role that she is working on?
Yeah, absolutely, and with particular reference, as was adverted to in evidence this morning, to the learnings from cross-jurisdictional comparison and the learnings of other jurisdictions, with a view to put it quite directly, that New South Wales tries to lead the way and learn from the federated experience.
So she's not going to be responsible for the development or implementation of the framework. That will come later.
Correct.
And then this body of work will then help.
Well, she will complete. I take it there'll be advice that is considered by government, and then government will determine its response to that.
And that advice will be given to Minister Harrison.
Minister Harrison.
Minister Harrison.
And noting that this is an area that does cross other parts of government, but the reporting arrangement in terms of this piece of work is Minister Harrison.
Okay. And then just finally, a couple of questions. Are any staff assigned to work for her on this particular body of work?
She is being supported by, Ms Quincy is here, but by existing staff, because this piece of work feeds on and feeds into an area which is very, very active and quite coarse. So risk assessment within the domestic, family and sexual violence realm is at the core of much of the work under the direction of Ms Campbell and Ms Quincy that they undertake. Those staff are in place, so it's very much with existing resources.
That's fine. And then finally, is she physically located in police or DCJ?
Physically located within DCJ, and bearing in mind that she's been very active and out and about, but absolutely within DCJ, and has the support that she needs to work from a particular location.
Okay. And that will remain until the 30th of September?
Correct.
Yeah. Just in relation, only because we're already talking about the risk assessment, just time frame in relation to the implementation or the announcement of the framework and implementation.
Arising from Ms Webb's work, or?
Oh no, overall.
So I might defer
moving
Ms
more broadly
Campbell on that one.
So we've actually consulted on the framework, so we've got the framework. So the focus of Ms Webb's role really is lessons learnt from other jurisdictions in terms of implementation. But I'll hand over to Ms Quincy because she's been intimately involved in this.
Because I understand there, based on last estimates, June to August last year, consultation occurred. And so I suppose the question is, what's the delay in? Is it just this body of work that you're relying on to then be able to make the announcement?
Yeah, so the framework, so the documents in the framework have been developed, and like it's been said, it's now thinking about how do you implement and roll that out. That is dependent on then the lessons learned from other states and territories. And so I think really the insights and the findings from that and the insights around implementation would lead into when the framework is released and when that work starts, and that might look quite different depending on what the insights are, because other states and territories have done it in quite different ways.
So you don't have a time frame?
I think we'll have a sense of that following the report from Ms Webb. We have funding for this financial year, so work is ongoing and will be happening, but the actual release of the framework I think will be dependent on those insights and the response to that.
And that's the 3.6, is that million just for this year?
Yes, correct.
I might move on to some questions around core and cluster. And specifically, I just wanted to go through tranche 1 and 2. And my colleague might also jump in on some of that. So I just wanted to get an update as to, first of all contracts have been signed, is that correct?
Yeah, all construction contracts.
Yeah. And so getting an idea with all the ones for 1 and 2 as to where they're up to, have they commenced and is there an expected completion date?
That's quite a lot of detail over 49, but as you know, 10 have already opened. I'd probably prefer to take it on notice, if that's okay, to give you just a detail, because some are at various stages of construction, rather than going through all 49 today. There have been delays, as the Minister said this morning, on a number of those, and that's partly due to either some issues that were discovered post the procurement process in terms of sites that had been selected, so we've had to shift to other sites, so that's delayed it because you've then got to do your due diligence on that. There have been issues in terms of construction costs and getting access, particularly in regional New South Wales, to the right labour, but we're monitoring it really closely. We're also looking at, there have been some hold-ups with DA approvals, but we've now got the DPI involved, and they're doing a concierge service for the core and cluster, tranche 1, 2 and tranches, the ones that haven't been finished, so we've been able to expedite some of those. There's been in a couple of locations community concerns about having a core and cluster in the neighbourhood, which has been unfortunate, so we've had to work through those issues because we, as you know, think these are really important services for women and children, and particularly in regional New South Wales where the services perhaps haven't been in place in some of those locations. So happy to take on notice more granular detail.
And with that, if you could identify, particularly where it's sort of DA or construction, not so much maybe the community issues, because that could identify localised issues, but more the broader delays that have caused, that have been caused for that.
Yeah.
Thank you.
And we are working with DPI at the moment to look at how we can even expedite some of that even further.
Yeah. Okay.
Yeah.
Can I just ask specifically on that, so rather than all of 49, just one? When I was the member for Monero, I announced the Queanbeyan core and cluster on the 25th of November 2022. Why it has been so delayed? Is that attributed to funding, site?
I don't have that detail with me, but again, happy to take that on notice for Queanbeyan.
That would be great, and if you could also please clarify for me. I do understand from having information relayed to me directly from those involved in Queanbeyan that there has been an issue around the funding, and obviously with that length of delay from 2022 and we're talking about August 2025, I would imagine that construction costs have escalated in that time. Is that part of the problem, and will it be addressed?
We've certainly had a number of projects that have been delayed for a year or two, partly because of the things I talked about earlier, and we've worked with those proponents to make sure that we're partially, in some instances, we have provided some additional funding to recognise the change in costs for delays that were outside the control of the provider.
Okay, so yes, if you could just clarify which of those issues. I don't believe that there were community concerns in that one, and I would be interested to hear. And so, and just clarifying that the plan, design, etc., none of that would have altered in this one instance. The plan and design remains the same.
Yeah.
Yeah, that's all good.
I could go back to a question I think Ms McLaren-Jones had this morning about the use of modular buildings and those. So I have got a little bit more information here for you too. I should have looked at my notes beforehand. To Miss Overall. So how many of the projects operational were new builds? Of the 10 projects that are operational, 4 are refurbishments and 6 new builds. How many projects are modular housing? 3 projects from tranche 2 are modular, 1 project from tranche 3 with a possible 1 more from tranche 3 pending the outcome of a building assessment. How many projects are yet to start construction? So this goes a bit to your question. 14 projects are yet to start construction due to being in various stages of planning approvals. So that goes somewhat to your former question. Why was the Queanbeyan project delayed? Construction was predominantly delayed due to the tender process run by the provider to engage a builder taking longer than expected. The provider has confirmed the contractor has been engaged and on site as of this week, on the 18th of August to be precise, and work commencing this coming Monday, you'll be pleased to know.
Terrific. And an idea of completion?
I haven't got that much.
Do you think you might be able to ferret down a little bit more and get something like that to me? Would there'd be a timeline?
There would be a timeline we could provide on notice.
That'd be fantastic.
And obviously it's subject to, you know, when they're building something, they might find something, you know, those sorts of things.
That would be great. Okay. Thank you.
Just in relation to 3 sites, one Eurobadella and then the 2 in Shoalhaven, all 3 are tranche 2. Where are they up to? Are they commenced or?
I'll take that on notice.
Okay. And just around modular construction, so there's one that's already been completed using modular?
Yes.
And then there's another which will be, that's tranche 3. Any issues around the construction or using modular housing?
Not that I've been advised of.
Can we expand on that a little bit more? How are they selected to be modular, and will we be looking at modular construction into the future for further projects?
Potentially, yes.
It's cost effectiveness.
And it's quicker.
It is absolutely quicker. It's,
yeah, and we're certainly doing
well
that.
Good.
The Women's Community Shelter, I think there was an opening a couple of weeks ago of the site, and the modulars, you might have seen it on the Channel 7 or Channel 9 news, where they could actually download it onto the site and it was made overnight. So,
absolutely.
yeah, I think there's opportunities, yeah.
And so we just haven't, the reason that we have so few at the moment is we're just beginning to explore these options.
Correct.
Yeah. Okay, great.
Although I do think in Minister Jackson's portfolio that they've been looking at modular housing, so that might be something to ask that portfolio.
My colleague asked this morning around good practice guidelines, and I just wanted to get a better understanding of what support or what work is done to work with providers that may not have worked in the domestic violence space.
When we went through the procurement process, that was one of the criteria. They had to have expertise in terms of domestic and family and sexual violence. Sometimes the community housing providers may not have, but the service delivery component of that may have. We've included it it was part of the contract, services contract, in terms of meeting particular things. So we've been monitoring that through our contract managers within DCJ once they're up and running. And we're also pretty confident we're looking at a communities of practice as well in this space.
And what will that entail?
Basically, communities of practice is looking at good practice. So DV New South Wales have been heavily involved in work, particularly in core and cluster, as has Homelessness New South Wales. And it's really looking at sharing good examples of practice, how to implement contemporary evidence-based practice about working with trauma, those sorts of things, and particularly a greater focus now, I think, in New South Wales on children in particular who accompany women to these services, and about how we work in a more informed, trauma-informed way.
And I suppose the monitoring or the ensuring that good practice is adhered to, would that be managed through DCJ and through the contracts? Okay.
Correct.
Thank you.
Thank you, Chair. Just turning back to the specialist workers for children and young people, how many workers are currently employed under the program?
I might have that here, or I might not. But I can take it on notice if I don't. Here we go. 45 workers to support children and young people in over 22 refuges, but I think that's gone up because I think I recall saying something this morning about 55.
Yeah, 55.
Yeah.
So how many full-time equivalent positions then?
That would be full-time equivalent.
Okay, understood. Has DCJ done any modelling to estimate how much it would cost to expand that program beyond the current 32 funded women's refuges to all existing refuges,
I think we
including the
have.
Yukon cluster?
I think we have.
You have?
Mm-hmm.
Are you able to provide any details?
I'll take it on notice.
Thank you. You'll be aware that Wagga Women's Health Centre was recently unsuccessful in that primary prevention grants program that we were talking about earlier, and the centre has now had its funding removed, as I understand it. Can you confirm, out of the recipients of the primary prevention funding, how many are regionally located? Just have a little look.
I might ask Ms Quincy, do you have that handy?
It's in here, I'm just pulling it up.
And just to confirm, just while Ms Quincy is finding it on the specialist workers, I've just found the other note, 55 specialist workers, so FTE, across 32 refuges as opposed to the 22.
Okay.
Yeah.
Thank you.
Sorry, I'm just pulling it up.
Do you want me to ask? I can ask another question and come back if you like while you're finding that. The electronic monitoring program, in the 25-26 budget, the government announced $4.6 million for the domestic violence electronic monitoring program. Does that funding include an allocation to WDV CASAs for victim survivor safety support?
I do not believe so.
No.
But if I need to clarify that, if my answer is insufficient, I will clarify that, but I believe not.
Thank you. The Domestic Violence Duty Solicitor program is not available in all local courts on ADVO list days for victim survivor support. Will that be expanded, particularly for regional areas? Has there been any work done on that?
I am straying close to the Attorney General's
okay.
estimates, but can I say, I would never sit here and say that there is not a need that is unmet, and legal representation is of it. The importance of it is acknowledged. Yep.
Are you able to take on notice whether or not there's been any sort of work done in relation to sort of modelling for that expansion?
I can. Can I just indicate I would want to interface with legal aid in responding to that question?
Yeah. Okay. Thank you. Ms Quincy.
No, I don't have that information in front of us, so we can take that on notice.
I've got it, Jen.
Oh, have you got it now?
Yeah. So there are 11 across New South Wales. The Moriarty Foundation in Dubbo, Catholic Care Central Coast, Zen Tea Lounge Foundation Cumberland, and then Consent Labs Sydney, Prosper, which is a mix, so Sydney, Lismore, Penrith and Wollongong. That's People with Disability Australia, Sydney Men and Family Centre, Lismore, Weave Youth and Community Services, Randwick, Young Women's Alliance, Lake Macquarie, Trustee for Top Blokes Foundation, Cessnock, and Settlement Services International, Coffs Harbour. So, large number in regional New South Wales.
Yeah, thank you. Very good. Just in relation to domestic family violence and disaster planning, I've asked about this previously, but is the New South Wales Government doing any work with Gender and Disaster Australia to incorporate the National Gender and Emergency Management Guidelines into New South Wales disaster planning, response and recovery? It's a very specific question.
It is that is like on a pinhead, that question, and I will not try and talk my way through it because I need to take that on notice, noting that some of this work does also the Premier's Department also has a role with some of this work.
Okay, thank you. If we could go back to the funding breakdown, just again trying to get a bit of an understanding of how much is newly allocated and how much is sort of repeat funding from previous announcements. So in the 24 to 25 budget, we had $245.6 million being allocated to domestic family violence. I understand that was over 4 years, but again, it's patchy as to where the amounts are. Are you able to tell us how much of that $245.6 million is included in this $272.2 million for the 25-26 budget?
Well, I'm not going to attempt just to calculate now, but I'm happy to take that on notice. It's not my strength. I need a calculator.
That would be very useful.
I can clarify that they are both separate announcements.
Yeah.
So the announcements that were made in the previous budget, the 272.7 is in addition to that. So there isn't an overlap between those two figures. Yeah.
All right, that's very useful. Thank you. When we come to the DV Notify scheme, do you have a timeline for when that will be rolled out and how exactly that $8.9 million of funding is allocated?
It's expected to be rolled out and trialled in a couple of locations towards the end of this year. In terms of the funding, I might hand over to Ms Quincy.
Yeah, so the intention there is to allow us to continue the pilot over a longer period of time. And also what we're doing is some of that funding goes to some of the specialist providers where we think there might be an increase in demand because of that scheme. So that's incorporated there. There's internal teams and a help desk to help with the kind of the back end of the notification scheme. And then also one of the things we're exploring is that when we did the user testing, something we heard from victim survivors that would be really beneficial to them would be a little bit more interaction with the portal and what they could actually do and kind of choose to do with it. So we're looking at potentially being able to design something like that and test that as well. So add more functionality to what we have at the moment.
Okay, thank you. So learning that is all new funding, that $272 million. Previously we were talking about exactly how much was included, and I think we got to the $25.3 million amount. We had the $11.2 million amount, and then Ms Campbell, you were sort of stepping me through a few of the others, and I think we got to another sort of 32 and a bit. That leaves about $220 million. Are there any big ticket items that you can list in that?
Let me have a look.
220 that's new.
I think I mentioned the Safe and Strong Families Targeted Early Intervention, so that was $7.5 million.
Yep.
The WDV CAS Hearing Support Program Expansion, that's 6.7, and this is all this financial year. Because over the forward estimates, it's 13.7 million for that particular one.
Yeah.
And sorry, I should have said with the TEI one, which I've now lost. Here we go. That's 21 million over the forward estimates. What else is looking large? The serious domestic abuse protective orders, so 9.3 million over 4 years.
I think we had that one.
Yeah, the DV Notify you've talked to. And the rest are sort of a mixture of between over the forward estimates of sort of 1.4 million through to about 7 million. There's one called Youth Justice Culturally Appropriate Alternative to Short-Term Remand, which is 3.8 million this year and 7.6 over the forward estimates.
Okay.
But again, happy to provide that on notice.
Yeah, I mean, how many items are we talking then in that list?
1, 2, 3, 4, 5. About 25, 30.
Okay. Still doesn't quite add up, I don't think, in terms of the...
I've got it detailed right to the 272.7.
Thank you. That would be incredibly useful. The budget papers, I wish they were more transparent, but they're not. Thank you.
It is on to us. Yep.
You want to go straight to the opposition?
Okay, thank you. Could I please burrow down a little bit further into the men's behaviour programs? Now, the funding, so you mentioned $13 million for 2025, 2026. Is that right?
Yes.
That's what I recorded just before the break. So that's actually decreased, though, from what it had been in 2022.
It should have increased because it was for additional sites.
Okay, so that's one of the things that I'd like to clarify, please. So the information, and I'm not suggesting that it couldn't possibly be incorrect, but in 2022, New South Wales and federal government jointly invested 18 million, and that was 15.8 million from New South Wales, 2.2 million from the feds, with a view to triple the number of programs available in New South Wales. And then in 2025, so we would have been 2024, was 10 million, you said, and then it's just gone to 13 million. So you might want to check that 2022 figure, if that is correct, from 18 million.
I'm sure it's in here, so
Yep.
I'll take that on
Yeah,
notice.
yep, that's fine. Yeah, that's okay. That's if you're able to check that for me, because I would be interested in confirming if that's the case. And is it possible to request a breakdown of that funding with the expansion of these sites?
Yes.
Can get that. That would be terrific. And my understanding and the reading that I've done about it is that demand for these services is very high and there are wait lists. Is that correct?
I'm not sure if there are wait lists. I don't know, Ms Quincy, if you've got more detail.
Yeah, so we're going through a process with the men's behaviour change programs of introducing a minimum data set and improving our data collection. So we're working with all the providers on that. We are aware that there are some wait lists for some providers, but those wait lists can also be influenced by someone might be on a wait list, but then they're assessed as not eligible. So there's different kind of categories that we're working through to get some better data on what that looks like and what demand looks like. But as it isn't a statewide service and it's recently been expanded, we know that there is more demand than spaces with what is currently there.
Yes, definitely. So are those criteria for who qualifies for assistance in that space, they're publicly available?
I'd have to have a look. We've got quite detailed kind of practice standards for the men's behaviour change programs. Providers have to go through a registration process.
Yep.
I don't know if every program has exactly the same criteria, but we can take that on notice.
Great, and if it's possible to have that provided, I'd be very interested to see that. And coming to that, the participants, are they all self-referring or do they also come through the justice system?
I think it's a combination.
Right. And there would be, I imagine, some of these programs that are only for those who come through the justice system. Is that how it would work as well? Is it, or would be open to all?
They're all voluntary, aren't they?
Yes, yeah.
I think an
they're all
important point to be
voluntary.
made here,
Yep.
exactly so, and I'm happy to be corrected by my wonderful team, but as the nature of the programs is voluntary, it's
So that's even whether they're through the justice system or individual.
Correct. So they're not.
It's all
they're not
self-referring.
imposed.
Yeah.
Yep.
Okay. So there's no court-imposed requirements in that regard. You talked about that there is the report that's coming. So is that the 2024 ANROS report? The undertaking an evaluation of the men's behaviour change programs is
No,
that it?
that's not it. It's not due till next year.
December 2026?
Yeah.
Yeah, and it's being conducted by ANROS with the Melbourne Institute and Modern Glace as well.
Yeah, and so that's an evaluation of the men's behaviour change programs that are in place right now that are in existence? So that's not necessarily these new sites, that's what's already been in existence?
I think we'd be picking up on the new sites as well.
Yes, we would. So it would be all New South Wales funded men's behaviour change programs. So that would be the ones that were originally funded and the ones that have been funded through the expansion money as well.
Okay, and I may be jumping the shark on this, but is there any information to hand prior to when these results will be produced next December as to evaluation criteria or what it is that they'll be looking at in terms of these programs? Is that available earlier?
We can look at the scope. I think we can provide that on notice, the scope of the evaluation.
Yep, that would really be helpful on that as well. And then when it comes to the programs and the locations, how are they being selected? Again, are they coming forward and requesting funding? How is that happening?
No, we go out. What we do before we go out for commissioning these sorts of services would be looking at the data that we get from Boxer in terms of, incidents
problematic areas?
Yeah, and incidents of DFE. So there's been quite a number of the newer services that'll be in regional New South Wales because of the high rate of reporting there. We would do a market analysis. We'd look at a needs analysis about locations that don't have any access to these sorts of support services. Obviously, with the Men's Behaviour Change Program, it doesn't cover the whole state at this point. So we'd be looking at prioritising based on demand and need.
And so does that mean that because this evaluation won't be ready until next December, that there won't be any further sites or programs initiated between now and then that aren't covered by this current tranche of funding?
Correct.
Right, so it'll be at least until then that we'll look at further expansion. And are other options being looked at, such as online options and availability for these programs, or we're just sort of at the minute it is these on-the-ground providers that are being facilitated?
Yeah, we're also looking at people who use violence and what the research and evidence tells us about that. So obviously that'll come into the mix once we get that report through later this year. So that might feed into, have we got the right mix of services? Have we got, a strong evidence base in terms of what works or not? At the moment, we don't really have good evidence around the Men's Behaviour Change Program. Not saying that they aren't doing fabulous things out there, but we kind of need to do that evaluation to be comfortable that we're investing, government funding into something that's making a difference.
And is that why it has and will, the evaluation process will be taking 2 years in order to provide the necessary data to back it up?
Yeah.
Okay, so we're sort of in a little bit of a conundrum. We've got men waiting to be helped potentially, but we still need to evaluate whether it's working and whether it might need to be altered in that space. Okay, I really appreciate all of that additional information. Thank you.
I just a couple of questions in regards to the workforce strategy announced this morning. So it's 2.5 for this financial year. Has any budget been allocated for the next, beyond, so just for this?
Just this first, yep.
And what will that cover?
I might hand over to Ms Quincy because she's right across this.
I can answer that. So there's work. So what's been specifically allocated to the strategy is the 2.5 from this year. There's also work from other funding from the National Partnership Agreement and within existing resources that's supporting work underneath the strategy. And then there was also some funding in the emergency package as well that goes towards some of the actions as well. So there's a mix of funding to allow us to progress some of the work.
And that's on top of the 2.5?
Yes, yeah.
And so what's the total amount for this financial year?
This financial year, it's about 3.5. And then in addition to that, it came up earlier this morning, was around the quality standards. That's a separate piece of work as well, and there's separate funding to even New South Wales on that as well.
Have you factored in evaluation of the strategy?
Yes, so we're developing up a monitoring and evaluation framework to go against the strategy and the actions, and that will then align with the work that we're doing on the data strategy and also the outcomes monitoring and reporting framework as well.
Okay. Now, is there any work, like in the strategy, and it's what we already know, particular burnout with staff, vicarious trauma, is there anything that's actually being worked on now to address that? Or is it all within the strategy, some more planning?
Yeah, it's within the strategy. The strategy, because it's a 10-year strategy, we've learned a lot from what other states and territories have done. So other states and territories that have a 10-year strategy, they have rolling 3-year action plans. And so where this strategy has engaged with workers and experts saying these are the things we need, the first step is then to develop the detail of what they are. So that doesn't mean that nothing's happening, but it means that where we've identified something from that research and that consultation, such as more standardised or more consistent clinical supervision, then how do we roll that out and what does that look like? That doesn't mean that clinical supervision isn't happening at the moment. It is built into services and providers, but we're hearing it needs to be improved from the workers, and so that's the first step, is working through what that looks like.
Is the intent to also have a 3-year action plans, or?
Yeah, so
it will be 3 years?
So there's rolling 3-year action plans that support the 10-year strategy. And so also what that allows us to do, which we've seen other states and territories do quite well, is then be able to kind of refresh and learn as you go, and also if there's more funding available and as the workforce changes, that we can kind of iterate as we need to.
And when's the first action plan report likely to be announced or released?
I'll have to take that one on notice.
Okay. The all-in early childhood pilot, I understand that's been funded for 4 years.
That's correct.
Yep.
It's under the emergency package.
And where will that be piloted?
Let me just find it for you.
And it's commencing this financial year?
It's already commenced. There were already existing services prior to the enhancement. I'm sure I've got a table here. I do. I've got lots of tables. Here we go. So in 24-25 there was 1.9 million. This is the enhancement under the emergency package. In 25-26, 2 million. In 26-27, 2.1 million, and in 27-28, 2.1 million. So in total, 8.1 million. Mm-hmm. And the Women's and Girls Emergency Centre has been contracted to deliver the all-in program expansion through till the 30th of June 2028.
And do you know where it will be expanded or rolled out to?
I do have that in here, but I'm happy to take that on notice.
And then has been budgeted for an evaluation of the program?
I'm pretty sure it has, so let me take that on notice just to confirm.
And also the timeframe around the evaluation, when that will commence. Okay. And likely to have the outcome of it. In relation to Safe Work New South Wales, just interested to know how many workshops have been held with employees on the drivers of workplace gender-based violence and prevention.
That falls under the primary prevention strategy work, I think, is where that's coming from. So we'll have to take that on notice, the number that occurred. So.
Okay. And also, so how many they've held since they received the funding, and if there's any more planned for this financial year as well. In relation to the interim evaluation report on the New South Wales volunteering strategy, I just want to know if that's commenced.
Can you repeat that again, Mr. Clarendon?
The interim evaluation report on the New South Wales volunteering strategy.
I think that's been finalised.
Oh, okay.
I'll take it on notice, but without opening my folder, I'm pretty sure it's been finalised.
And could you then also advise who was involved in the consultation on that evaluation, who conducted it, and what the outcome is, and if it can be released? 4 things.
I'll just see if I've got it here to save staff. it's not jumping out at me, so I'll take that on notice.
That's fine.
Oh, wait a minute. There's another note.
Carers and volunteers, it's always...
The New South Wales Volunteering Strategy Report Card is released every 2 years. The first report card spanning 2021, 21, 22 was released in November 2022. The second report card spanning 22, 23 and 23, 24 was released in August 2024 and is on the New South Wales volunteering website. The third report spanning 22, 24, 25 and 25, 26 is scheduled for release next August.
And then there's also meant to be an interim evaluation report. So not the report cards.
Yes, there's another one. Yep, yes, I know this one. The strategy notes that the interim evaluation report will be prepared and released in 25-26.
Yep.
Obviously, we've passed that. This report will consider the initiatives implemented and data from a range of sources, such as the New South Wales State of Volunteering Research Initiative. I'll need to take on notice the timeframe around that.
Yep. And so that's the one that has been completed.
Yes.
Yep. Yeah, if you go.
Yep. Just still on the domestic and family violence, the Primary Prevention Multi-Year Partnership Grant Program, $5.2 million, is that correct?
Yes.
How much of that was allocated to programs in regional New South Wales?
Okay. Have a look.
Thank you.
There's lots being allocated. I've got a note on regional New
Excellent.
South Wales.
That's
it's
what I
very
like to
thick.
hear.
Used to be thinner. Local support services, Foreign cluster.
I have to admit, Miss Campbell, it's like I do appreciate the old school variety. Of it. Like, not just turning to the laptops and AI. Who needs that? Do it properly.
You've got it. That's why I've got Jen here today.
I've got them. So we've got them. I've got all of them. So the Moratori Foundation in Dubbo. We've got the Catholic Care Diocese of Broken Arrow and Central Coast. Zen Tea Lounge in Cumberland. Consent Labs across Sydney, Western Sydney and regional New South Wales. Prosper, Project Australia in Sydney, Lismore, Penrith, Blue Mountains and Wollongong. People with Disability Australia in Sydney, Wollongong, Central, West, Hunter and Wagga. The Men and Family Centre in Lismore, Weave Youth and Community Services in Randwick, Young Women's Alliance, Lake Macquarie, and then Top Blokes in Cessnock and Settlement Services in Coffs Harbour as well. They should all be publicly available, and if not, they will be shortly.
Okay, great. So,
can I also add to that? Sorry,
yes.
There's also $3.7 million in addition for Aboriginal community safety grants, and 23 of the 32 grant projects are regional, rural based.
Right.
I can provide them on notice.
That would be lovely.
Yeah.
If you could do that, I would very much appreciate that, and that information as well would be very, very helpful. Because I've still got 2 minutes there. Mr. Tidwell, we talked about the senior state budget for 2024-25, the $9.7 million, so from last year rather than forward. Can you let us know some of, or all of, how that was allocated and to what during that period?
I can indeed, and
Excellent.
the person on the right has saved me in responding to this question. So if I can take you through just the totality of that. Oh, it's 10 point.
It is 10.1 million
It's
for 25-26.
So it's
okay.
25-26. No, I think it was
24
last
to
year,
25.
Yes, in
But have
24,
that.
25.
Please have that handy. It's like I'll be interested to know that as well for 25-26.
Well, I can. Yeah. Do you want to?
Yeah,
it's a
absolutely.
really simple
Let
read.
us know that, but also interested in 24-25.
So Connecting Seniors Grants Program for 25-26, 840,000.
Yep.
Seniors Festival, including 200k grants, 500,000.
Yep.
Seniors Concerts, 1.75. Seniors Programs, 1.475 million for Seniors Concerts. Seniors Programs, 3.5 415. Seniors card operations, which I can itemise that for you. Tech-savvy seniors, senior stories, seniors card, and other card operations costs for seniors. Then the Ageing Peaks program, $1.8 million, and that comes to 10.120.
10.1. And yes, if I'm able to have that information, please,
Forward.
and the comparison to 24-25 on each of those programs and how that may have changed or increased, or
yeah, the difference
it's not a lot.
between
What's that? 400,000 extra from 25 to 26.
and I think that's indexation.
Yeah. Okay.
Because
So
they're the
it's-
same programs that were funded last
yes,
year.
I'm just ticking off there.
Okay.
Yep, and I might come back to some other questions about that as well. Thank you.
Thank you. I'm going to ask some questions of Ms Tonkin, if I may. Can you give us an update on the qualitative research project on coercive control that you've been leading?
Yes, sure. So this is not just on coercive control, it's on domestic and family violence more generally, including coercive control. So it's a partnership between my office and Boxar, and it's a one-year qualitative research project to explore the experiences of victim survivors of domestic and family violence through the criminal justice system, including other services that they're referred to. We deliberately waited for 1 year after the coercive control laws came into effect before starting the research, because we wanted to make sure that those laws had time to sort of settle and work their way through the system. But the project is broader than that. So the project includes any domestic family violence victim survivors. So it's not just intimate partners, for example. It's not just victim survivors who've reported coercive control. It's victim survivors who've reported to the police any domestic family violence crime. So that procurement process has been completed and the research will start soon. That's where it's up to for 1 year.
Last estimates, I asked you about the issue of police perpetrators,
Yes.
domestic family violence, particularly in relation to systems abuse and coercive control. You said it was something you were looking at.
Yes.
I know that I spoke with the LEC Commissioner yesterday in relation to the work they've been doing. Have you got any sort of update or progress on that issue?
Yeah, so I have followed up in a few different ways. I've met with the LEC Commissioner about this issue. I've also met with Assistant Commissioner Peter McKenna. I asked Mr McKenna and he agreed to come and present to the monthly sector group meeting that I chair on this issue. So he presented in June on the process that the police follow when a police officer is accused of domestic and family violence. So that sector group meeting includes, it usually has about 60 or 70 people. It's online, so it's very well attended, includes all the main players in New South Wales, usually at a leadership level. So that was a really good discussion and they had the opportunity to ask him questions. We've had follow-up discussions. There's been a discussion of possibly the police developing a fact sheet or something like that for the sector to say this is a process that we follow and to set it out. So that's where we're up to now. I think we're making progress. We haven't got a concrete a fact sheet or anything yet, but that's what we're working towards.
Okay, all right. Thank you. I understand a roundtable was recently convened with yourself, Safe Work, Liquor and Gaming, the Nighttime Commissioner and some victim survivors. Can you give an update on how that went and sort of what next steps are from there?
Yes, you mean the one about workers' safety in the nighttime economy? Yes, so that was focused predominantly on the hospitality industry. So it was co-convened by myself and the 24-Hour Economy Commissioner, Michael Rodriguez. And as you said, it included a number of the key players from government, so Safe Work New South Wales, victim survivors, particularly the Sorry Not Sorry victim survivors, but also importantly a large number of industry representatives. So a lot of the leading, the hotel industry, different hospitality industry, also Maryville, Swill House, some of the particular businesses that have been in the news for these reasons. So this brought all of them together to have a really robust discussion about the safety of women in particular in the hospitality industry, women workers. Full Stop Australia was also there, which was really important, and we also had representatives from unions. and one academic expert. So following that discussion, we developed a set of sort of what were the key themes that came out of the discussion, discussed it with the ministers, and now there's some follow-up action that we're discussing at the moment. So I'm not sure where things are up to exactly, but some of the things that came out of the discussion that we were looking at were things like licensing laws, like licenses and conditions, and whether you could have, that as a sort of lever. Also training. So training was a big theme. So we followed up on that. What sort of training should be available? Also, of course, they've introduced now into the responsible service of alcohol training now has to include training on sexual harassment. So that's new. So there have already been a number of concrete actions, I think, that have come out of it, and I think there will be a few more in the next few months.
Okay, all right, thank you. Full Stop have been advocating for funding to roll out the Good Night Out pilot, but they haven't got funding as far as I know. Everyone seems pretty keen. What's holding it up? Is it something that industry should just be getting on board with and helping to fund?
I'm not actually sure about that. I know that was in their pre-budget submission that they published earlier this year, but I'm not sure about the reasons. Do you have any more information on that? I might have to take that on notice.
Thank you, that would be useful. In relation to the rollout of sexual harassment and sexual violence prevention training through the RSA, my understanding is that only new staff entering the industry or completing RSA for the first time are going to be receiving it. Is there any move to make it so it's a compulsory thing sort of going forward with sort of ongoing training for people working in the industry?
I'd have to take that on notice.
Thank you. I think I can probably just settle there if you like, if you want to.
Yeah, I'll go to a couple. Just to come back to the seniors, how many businesses are now part of the New South Wales Seniors Card Discount Scheme?
We always have that.
We
It's
do
a
have
race.
it. We do have
I
it.
know.
It's a reliable
you were prepared
one.
for me.
I'm racing you out.
Okay, I'll let you win. So more than 319,000 members have opted in to receive a digital seniors or senior saver card as at the 10th of July 2025.
Are those numbers up? Or
Yes.
it is up, yep.
More than...
So 2,500 participating businesses.
Good.
2,500.
Yep.
And that's up as well.
I'd need
I'm
to take
sure
that on notice.
I am
say absolutely.
responding
Take it
to
on
the way
notice.
you've described that. I have no idea. I assume it would be. I hope it would be. It's 2,500.
I hope it would be too. It's let's perhaps just take on notice to clarify that if that's an increase, that would be lovely. And what about the expansion of offerings? That's, I guess, where that question was going. If there's been an increase in the number of businesses, is what's being offered to seniors expanding as well?
We need to take that on notice, Mike.
Yeah, we agree.
Yep.
Okay, that would be lovely if you could do that. Now, the 2026 Seniors Festival to take place March 2nd to 16th.
Yes.
I think it'd be at the top of the note. Oh, here we go.
Yes, there's an allocation for the 2026 festival of. It's a number that I believe the number because it's got. I believe the number is 1.925 million to scope, plan, and deliver the Seniors Festival, including the Premier's Gala concerts, the Seniors Festival Expo, Senior Regional Christmas concerts, and the Seniors Festival comedy shows.
Okay, so you know where I'm going next, don't you? What about regional events on that list?
Which I'm sure are there, and I'll take them on notice.
I can.
That would be great.
I think this is sort of more since
There is a regional comedy show.
There is.
Yep.
There is. The Seniors Festival regional comedy shows were first held in 2023 in Port Macquarie and have since been held at Bateman's Bay and Port Stephens. Location, dates and venues for 2025 will be announced later this year, so I'll have to hold off the locations until it's announced.
Right, okay. And now
And
because...
can I just supplement that? There also obviously is the Seniors Festival Grant Program for 2025 that had 35 applicants that sought and which were granted funding, and it was regionally quite distributed. I'm happy to name the locations if you would want.
no, that's okay, but could you please... So 35 applicants, so what's the process? You open it up...
Sorry, I apologise. 35, my answer is not strictly accurate. 35 applicants received funding. The actual number of applicants I would need to take on notice.
That would be wonderful.
But
if you
there
could
were, as
do
I
that.
say, there was a significant number of them so Port Macquarie, Dubbo, Clarence Valley, Wollongong, Bathurst, Gandra, Edward River, Narrandera, Inverell. I can keep going if you want.
No, but I'd happy to have that provided on notice. Right. And again, so if there's 35 applicants that receive funding,
yes,
there's criteria evaluation process that is attached to that as well. Can
Correct.
we see that as well
Yep.
to know what's involved in how all that happens?
Yes.
That would be very helpful. Thank you. And because we had such a wonderful moment on it last time, as I'm sure that you'll all recall, you'll have to know where I'm going next. Grandparents' Day.
Of course.
So it's still scheduled for October 26th of this year?
Correct.
And has the New South Wales Government website been updated with 2025 materials and resources?
I'd need to check.
I've got no idea.
That would be great. But as long as we're going ahead, as we said last time, grandparents everywhere will be very happy.
That's a good thing.
I'm not one, so I'm just saying.
I am.
There you go. Are you happy, Mr. Borsak?
Always.
The Honourable?
You never seen me unhappy.
No. Thank you.
Just following on in relation to Seniors Week and regional locations, how are they selected?
I'd need to take that on notice. Yeah, I'll take that on notice.
And just in relation to, again, going back to that workforce strategy, what, I suppose, has the department done any assessment about the current workforce shortages?
We have for different reasons, but probably not in the context in which you're asking the question. I don't know, Ms Quincy, if you...
Not specifically. It's something that we're hearing about. It's something that when we did the survey was kind of the first time we had a sense of what the size of the workforce was. And we're learning some things through the rollout of the new workers and secure jobs and funding certainty, but not specifically for the workforce strategy.
And are you planning to do that assessment, to know what the shortages are and where the demand is?
I think we're very interested in learning more, and some of the work in the workforce strategy is understanding more about the workforce, and it would include understanding where they are, where the shortages are, and then what the pipelines can be and how we can kind of encourage more people into the workforce in the areas they need to be at.
And also to retain people in the workforce is really important too.
That's fine. And I've just got a couple of questions for Ms Tonkin in regards to the research that was undertaken over 24, 25, which relates to question put last estimates. And just wanted to get a better understanding around the qualitative research to understand the justice and service systems experience of adult domestic and family violence victim survivors post-coercive control reforms. And where that's up to, if the research has been done, and then where is it, how is it released or dealt with?
Yeah, so that was what I was just answering Ms Boyd's question about. So yeah, no, that's okay. We were deliberately waiting for 1 year after the coercive control laws came into effect before starting the research. That takes us up to now. So we've done the procurement process because it's a significant piece of work. So we had an external procurement process, a number of applications, and the research will start soon. Okay. And we'll go for one year.
And then in relation to the misuse of New South Wales government services and products by domestic violence perpetrators and how that's going to be prevented.
Yes.
So has that research all been completed, or where's that up to?
Yeah, so phase one's been completed. So I might have mentioned in the last estimates that this New South Wales started this work, my office in partnership with Catherine Fitzpatrick, we started this work in about May last year, and then in August the rapid review report was released at the federal level, and that recommended that all governments undertake this audit. So we were already a step ahead in that sense. And then the federal government started an audit of this nature. So they're doing a quite extensive audit of the federal system, so particularly family court, immigration, tax and child support. So they're the key systems at the federal level. So that's happening. At the state level, so we did a phase one, which was a review of qualitative analysis, interviewing victim survivors and service providers to understand what are some examples of the misuse of government services and processes in this context. And that was really insightful. And now we're at stage two about what do we do about it in terms of preventing it in the future. So we're working very closely with Service New South Wales and also Revenue New South Wales, Transport, also to a certain extent, other colleagues in the Department of Customer Service. And now we're looking at rolling out training and capability building. Actually just had a meeting just last week with Services Australia because they're also doing similar work. So we've agreed to really collaborate closely and share our learnings for Services Australia and Service New South Wales. And it's progressing really well.
How does transport fit into it?
Transport's less of a focus, but it did come up in a few different examples. So licensing, for example, there are some examples of like licensing, Opal cards, that sort of thing. So it was a bit more peripheral, like Department of Customer Service and Revenue New South Wales, really the main ones. But yeah, transport did come up a little bit, and they've actually keen to think about how they can be involved.
Okay, good. And the other one is Your Ground New South Wales, the crowdsourced social research. Where's that up to, and I suppose where does that body of work go?
Yeah, so that was completed in 2023. That followed a similar project that was done in Victoria, Your Ground Victoria. And so essentially it was inviting people across New South Wales to use an online tool where they could drop a pin on a map and say, women and gender diverse people, they could say whether they felt safe in that location and why or why not. So it's sort of qualitative insights more than anything. And then a report was published, and we've been working with the Department of Transport and Planning in particular. That's just been feeding into some of their work on the Safer Cities program. So it's part of that broader work that they do on Safer Cities. Yeah.
Okay. I'm fine. I can do the rest on notice.
All right, thanks very much. It seems we've come to the end of questioning. They've exhausted themselves with all the questions and answers this afternoon.
I'll just send them all through later.
There'll be more later. Are we having any government questions? You're exhausted too?
Yes.
Thank you. All right.
Thank you.
As you've taken a number of questions on notice, the Secretary will be in contact soon. Thank you very much for coming today, and welcome to the early mark.
Thank you. Thank you.
Thank you.